Anyone there?
Hello.
Yeah. Hi, this is Kalen.
Hello, Kalen. How are you?
Good.
Yes, thanks for joining. I believe we will start after a couple of minutes.
Okay.
Okay, thanks a lot. Hello, Rita.
Yes, hello, Hussein. Hello, Kalen.
Hi, Rita.
Hello, thanks a lot for joining, Rita. Thank you very much.
Yeah, you're welcome. I hope it works technically.
Yeah. I believe it will work. I believe also we have Dr. Ali from the Ministry of Agriculture. Hello, Dr. Ali. We have also Dr. Ahmed Adel, right? Hello, Dr. Ahmed.
Hello, Dr. Hussein.
Thanks for joining. Thanks a lot. دكتور علي السلام عليكم. So I just want to say hello for everybody. we're just waiting Dr. Ali from the Ministry of Environment, Water and Agriculture to start the meeting. So we are expecting to start the meeting within a few seconds. Sorry for this delay. Okay, so hello everybody. I will start in Arabic, then we will start to introduce our speakers. السلام عليكم ورحمة الله وبركاته. في البداية طبعا بحب أتقدم بالشكر للزملاء في وزارة البيئة والمياه والزراعة، ممثلة في الدكتور علي الدوارج مدير عام إدارة الصحة والرقابة البيطرية، وطبعا بنحيي كمان وبنشكر الدكتور رائد إبراهيم نائب مدير إدارة الصحة والرقابة البيطرية بوزارة الزراعة أو وزارة البيئة والمياه والزراعة في المملكة العربية السعودية، على إن هم ادونا هذه الفرصة إن احنا نكون متواجدين مع حضراتكم النهاردة في هذا اللقاء العلمي الذي أتمناه مثمرا بإذن الله. طبعا احنا اللقاء العلمي بتاعنا النهارده هيكون عن ورشه عمل عن استراتيجيات مكافحه امراض الجهاز التنفسي في الدواجن، workshop for respiratory disease complex. Today agenda, as you may see, my screen, there will be a first presentation will be presented by Dr. Kalen Coxon. Dr. Kalen Coxon, he is the director of the clinical research in Zoetis USCA. The session will be about immune suppression and its relation to the respiratory disease complex. This will be followed by Arabic translation by our colleague Dr. Ahmed Adel, our poultry technical and marketing manager for Zoetis in Saudi Arabia. Then the second session will be Dr. Rita Wipper. Dr. Rita is a poultry veterinary expert at Zoetis Germany. The session will be about control of Colibacillosis in poultry industry due to the impact and the role of the Colibacillosis in the respiratory disease complex in Saudi Arabia. This would be followed also by Arabic translation by Dr. Ahmed Adel. So before going to the first session, I'd like to give the floor to Dr. Raed to welcome you. Dr. رائد, the floor is yours. احب ارحب طبعا بالدكتور رائد نائب مدير اداره الصحه والرقابه البيطريه. هو حابب طبعا يرحب بحضراتكم. دكتور رائد طبعا احنا بنعتذر ان احنا بدانا، لكن طبعا اتفضل سعادتك يا فندم. I believe Dr. Raed, you are in mute. I believe there is technical issue from Dr. Raed's side. So I believe we can start directly with our first presenter, Dr. Kalen Coxon from USA. Dr. Kalen, he is the director of the clinical research in Zoetis USA. Dr. Kalen received his doctor or PhD from the North Carolina State University College of Veterinary Medicine after working as a resident in the California Veterinary Diagnostic Lab System. He went on to receive a master in avian medicine from the University of Georgia. Dr. Coxon has over 25 years of experience in the biologicals industry, working for Zoetis and its legacy predecessor as a technical service veterinarian who has supported not only the US, but every other major global markets. Dr. Coxon has expertise in vaccine programming and has provided critical input to new vaccine development. His role over the past several years has been Director of Clinical Research, where he helps Zoetis to execute its extensive applied research, mostly post-registration trials conducted under post-controlled and commercial settings. Dr. Kalen, the floor is yours. You are welcome.
Thank you. Okay, so let me know if you're seeing my presentation.
Yes, very well.
Okay.
Can you please put it in presentation mode? Thanks a lot.
Okay. All right. Is that in the proper mode?
Yes.
Yep.
Yes,
Okay.
it is.
Okay, great. Okay. Well, thank you for inviting me as a speaker. I'm glad to be here, talk about some very important diseases as we consider the big picture on control of respiratory disease. To do that, obviously, we're going to talk about the immune system. And this is a good basic slide to conceptually realize what's important about the immune system and some basic concepts about it. The first concept is that we have primary and secondary branches of the immune system. The primary parts of the immune system would include those that I have here in red. I don't know if you can see my cursor moving, but we have thymus, which houses the T cells. We have the bursa or fabricius, which houses the B cells, and we have bone marrow, which houses a lot of our blood cells, including our phagocytic cells, which will be very important when we talk, especially when we talk about bacterial diseases. Another thing that's really important to know about the primary versus secondary is the primary lymphoid organs. They're maturing in the first 2 to 3 weeks. And as those cells mature, they go and they travel to other parts of the chicken. And they're in traveling, they set up these secondary lymphoid organs, which will be essential for the bird's response to various viruses and bacteria. So you have some in the respiratory system, both in the upper respiratory and the halt, and the lower respiratory and the BALT. You'll have the gut-associated lymphoid tissues, and you have the cecal tonsils also. Obviously, those are very important for intestinal health. So the critical thing to remember is there's a critical window that if there's insult, especially to the primary immune system, which would be in that first 2 to 3 weeks, that's where you would have maximal impact on compromise to the immune system, not only to the primary, but also to the secondary systems, because proper seeding of them and development would not have occurred. So early infections tend to be more devastating. So we can look at, there are basically 3 types of immune response, and they're related to, I mentioned the bursa, the B cells. Those are where B cells are responsible for production of antibodies, so antibody-based immunity. And for these diseases, For circulating antibodies, Newcastle and avian influenza are very important type diseases. For locally produced IgA, for example, Newcastle and bronchitis would be good examples of locally produced antibodies being very important to controlling those diseases or having good immune response to vaccination. For cellular-based immunity, that goes back to the T cells, which the primary organ is the thymus. So diseases that can wipe out the thymus will have a major impact on these type diseases: bronchitis, TRT, infectious laryngotracheitis. They're all very, it's critical for a good cellular immune response for those diseases, as well as E. coli, other bacterial infections, and MG, mycoplasma infections. And then for the bone marrow, your phagocytic cells, where these become really important would be where you have secondary bacterial infections that come in behind a primary respiratory insult. Of course, what you'll probably hear today is that E. coli infections don't always need a primary insult. If you just have general compromise to the bird's immune system, then even primary E. coli infections can be problematic. Now, B cells and T cells, just a general comment. The immune system is extremely complex, but if you have a virus that insults the B cells of the bursa or the T cells of the thymus, you're not always going to just get compromise of that one arm of the immune system, because they're closely tied to each other in the way they communicate and present antigens and fight diseases. So it's not all black and white. So you can have compromise of both systems, even if you have a virus that primarily targets one type of cell. And here's a slide to just kind of give an idea of the diseases I'll be focusing on today, and which arm of the immune system they tend to target. So for chicken anemia virus, it destroys T cells in the thymus, but it also destroys progenitor cells in the bone marrow. So so you have T cell destruction, but you have phagocytic compromise of phagocytic cells. You can have bleeding disorders because of some of those factors that are produced in the bone marrow. Merrick's disease is more of a T cell destruction, but you do have some B cell. So I've placed it a little bit more toward the middle. Of course, infectious bursal disease, you would place over to the right because it destroys the B cells of the bursa fabricius. But again, it's not as black and white as you would think. And then reoviruses and adenoviruses, they tend to infect and destroy B cells, but again, there's probably some good overlap between B cells and T cells and destruction. Now, there's another way that we can look at these diseases, and that's their impact by different types of birds that we're raising, types of chickens. So we have over on the left, we have broilers, we have breeders, broiler breeders typically, generally, and we have layers. Okay, and then I've listed the 5 diseases we'll discuss today and their relative importance in controlling them to control immune suppression specifically by breed types. So for Merrick's, your long-lived birds are especially important. Obviously, it's important in broilers as well, but that's more based on risk and actual level of challenge. Whereas in a long-lived bird, it's extremely important to make sure you're controlling any possibility of immune suppression, because obviously you're living with those birds for a lot longer and they're more valuable to you. For IBDV, this is the one disease I think it's extremely critical to control this disease in all 3 of these bird types equally as much. Reovirus, CAV, and adenovirus, generally, I would rank the importance of controlling these on the broilers, from the broiler standpoint, to be driven mainly from controlling it for broilers. And the main reason I say that is because other than the fact that they can cause significant immune suppression and compromise of broiler programs and immunity, but because all three of these viruses, I think this is a good thing to remember, they have a great potential for vertical shed. So from from parent stock to progeny. And so that's a very critical consideration for their overall control and limitation of their diseases and immune suppression in the broiler bird. You have to first make sure you're controlling the disease on the parent side. In general, the earlier that these birds are infected with these viruses, the more profound the immune suppression. And co-infections with more than one of these organisms, you have the potential for even greater immune suppression. There can be additive impacts to the immune system. First, I'll talk about infectious bursal disease. Obviously, we're talking about the bursa fabricius is the target organ. And so this is what can happen. You can get significant bursal atrophy. So what's happening is it destroys the B cells, and therefore, obviously, you're losing the potential of that function by losing a lot of that functional B cell tissue. With IBDV, if we're just going to focus on the impact on the immune system, then we're really talking about timing of the field infection, and we have plenty of tools that allow us to determine what age flocks are becoming field infected or where they're at risk of becoming field infected. Just because we can look right to that bursal tissue, we can see when there may be atrophy or acute lesions from a recent infection. We can do histopathology, so we can get a sense for when that window of infection may be occurring. And in general, if you have an IBD infection that is infecting your flocks before 3 weeks of age, you have a greater potential, great potential for permanent immune suppression of that flock. Obviously, if you get closer to 2 weeks, that level of permanent immune suppression becomes greater. That said, even infections after 3 weeks of age can be significant because they can at least cause a temporary level of immune suppression. And depending on the timing of other infectious challenges that are happening, or as our birds are responding to, let's say, their respiratory vaccination program, say at between 3 to 5 weeks of age, that can have a major impact on that program. So with IBDV, when we're talking immune suppression, timing is everything. Now, here's some work that had been done. This is a paper from Avian Diseases many years ago, but it shows just how impactful is an early infection. And you can see even at 3 weeks of age with a 3-week IBD infection, you can have a significant reduction in the bird's antibody response to, in this case, a Newcastle vaccination program. So we're looking at HI titers. That's the height of these bars, okay? So with a 3-week challenge, you had this much depression of the HI antibody response to the Newcastle vaccination. So you're looking at probably an 80% reduction in that Newcastle response. Now, when we look at the day of age challenge, so you're infecting birds at 1 day with IBDV, you can see that that reduction in the HI titer response to the Newcastle vaccination is even more impacted. Probably have about a 95% reduction in that HI response. Now, here's a study that has not been published, but it was presented at one of our important scientific meetings several years ago by a world famous infectious bronchitis researcher, Jack Gelb. He was doing a bronchitis study. He was looking at how a Massachusetts plus Arkansas or actually it was just an Arkansas vaccination of broilers, how that could be impacted if you gave a late IBD challenge. So in this case, birds were vaccinated twice, day of age and then around 18 days of age. And then they were exposed to IBDV plus or minus the Arkansas challenge, the bronchitis challenge itself. And birds that were not exposed to IBDV, but just to the bronchitis, they had 90% protection against the Arkansas challenge. But if they were co-infected with IBDV at the same time at that 5-week period, then they had about 50% protection against that same Arkansas challenge. So you had a 40% reduction in overall immune response to that Arkansas vaccination program. Immune suppressed flocks, when we're talking about IBDV, we have to consider that you can have a poor response to the vaccines that you're giving your broilers, for example. But of course, this could apply even more so to long-lived birds because we're having to vaccinate them many more times. So the impact of not getting sufficient immunity from our vaccine programs could actually be even more impactful in long-lived birds. Obviously, they can be more susceptible to disease in general, especially diseases that require a strong IgG response. We can have poor livability, either from clinical IBDV, obviously, but from an immune suppression standpoint, from a secondary bacterial challenge, either secondary to immune suppression or secondary to one of these other, let's say, respiratory diseases, the birds not being as protected against. So how we might see this in broilers, we might see increased contaminations at the processing plant from increased E. coli infections, for example. But we might just see it in poor feed conversions. This can either be directly impacted by late mortality from any of these diseases if we have immune suppression, or by the fact that if birds are immune suppressed, they can't fight off infections as efficiently. And so they have to use up more resources, more energy has to go toward fighting infections than toward growth. And then with long-lived birds, especially in commercial layers, either an early or a late IBD challenge can also cause poor uniformity, and this can result in suboptimal egg production. When we talk about IBDV, and maternal antibodies are very important, and they determine how susceptible the birds will be to a certain level of challenge. In this case, you have a level of challenge that can penetrate these maternal antibodies, for example, at 17 days. If you have different levels of maternal antibodies, then for the same challenge level, birds might be infected a day earlier or a week earlier. And that's what this chart is trying to represent. And then if you have different levels of field challenge, even in the same flock with a certain level of maternal antibody defense, a low challenge will not break through that barrier of maternal antibodies, in this case, until 17 days, whereas a higher level of challenge can penetrate a higher level of maternal antibodies, and therefore, in that same flock, they could be susceptible to infection at a much earlier age. And then, so this chart shows if we have a modest breeder program and a slow, lower active immunity program, for example, an intermediate one-time administration of an intermediate vaccine, let's say these are commercial broilers. This is what this chart might look like. And if we have a low field challenge, then this type of program can cover that immunity gap that we have between passive immunity from the breeder program and active immunity that we acquire, that the birds acquire from vaccinating the broilers themselves. However, if those birds are placed, those same birds are placed in a higher challenge environment, say a moderate challenge level, then there can be an immunity gap between the modest breeder program and the modest broiler program. In this case, you could have an immunity gap where that challenge will occur between 2 and 3 weeks of age, cause immune suppression, and you won't have control of IBDV with this program. Now, this can be rectified in a moderate challenge situation by going to a more aggressive program. And that's what you typically will see in your region of the world. Most people would probably be using a strong vaccine if they're field vaccinating, or you could achieve this by going to either a recombinant vaccine in the hatchery or using an immune complex vaccine in the hatchery. Either way, you're basically improving your onset of immunity and your overall level of immunity so that you can still cover that gap between breeder immunity and the active immunization with a moderate challenge. Now, what happens when birds are placed in a high challenge area? Well, in this last scenario where you're on a modest breeder program and a strong broiler program, that may not be and will not be enough to cover that protection gap, and in this case would actually be in an early window if you have a high field challenge presence. And that's where strengthening the breeder program is critical to cover that gap. We have different IBD vaccines. We have conventional live vaccines. I mentioned intermediate versus strong and the benefits of one versus the other. We have immune complex vaccines. They're a good alternative. They're a live vaccine that can be applied in the hatchery. And then we have the recombinant vaccines. One thing that can be a consideration is the rotation between, let's say, recombinant vaccines and immune complex vaccines, because they do present a different type of different type of mechanisms to fight IBDV. Moving to Merix. The way Merix causes immune suppression is based in its pathogenesis and how it replicates. So there are two infection cycles. The first one is a cytolytic infection, and this is in T cells. And so you can see that there can be a great impact on cellular immunity if you have an early Merix challenge. And then there's a latent infection. This is in these activated T cells. They trigger an inflammatory response. Now, the whole concept of why vaccines are important for Merix control is you can't prevent Merix field infections, but what we hope to do is provide enough of them, arm the birds with enough immune response that they can limit the amount of infection, so that you're limiting these first 2 cycles of infection. That will limit the potential for immune suppression, but it will also limit the potential that there may be the second cytolytic infection, which can lead to permanent immune suppression, and therefore, and also eventually sometimes tumor formation. It's the second cytolytic infection that we hope to control by vaccination, because obviously for the same reasons we saw with IBDV. This slide, the main thing I want to impress upon the audience is that in this case, where we had a real increase in Merrick's field challenge in this broiler situation, the leukosis condemnations went from almost 0 to over 1%. Birds were condemned for tumors, for leukosis tumors. But at the same time, these same birds, their overall condemnations went from about 2% to 5%. So they had 3 times as many birds that were being condemned for general disease, mostly E. coli, than were condemned for the leukosis tumors. So if by the time you're seeing tumors, you already know you have permanently immune suppressed birds, and the level of tumor formation is just the tip of the iceberg. I'm going to move on to Reovirus now. Reovirus is the first of the last 3 viruses I'll talk about, and I mentioned that they're all are important. Part of their control is to prevent vertical transmission, and by doing that, you're helping to limit that early challenge where you have the greatest impact from these diseases. In the case of Reovirus, it's very hardy, just like IBDV. It's highly contagious. The way I think about it is if you have 50% of a broiler flock, for example, that are being placed at day of age that are susceptible to reovirus because they have low reovirus maternal antibodies, then that is enough. If you're placing them in a high challenge situation, that is enough that you can have significant spread within that flock. That's enough to get that started, that you have a significant amount of infected birds in that first week to 10 days, which is absolutely critical from an immune suppression standpoint, as well as clinical expression of disease. So our broiler protection strategy is to prevent vertical transmission from the hens. So keep them from being infected in lay and therefore shedding, but also to have high consistent maternal antibodies that are passed from the hen to those progeny. For years, antigenic diversity was not readily apparent, but in the United States, we started to see that was changing. We saw it happening as early as 20 years ago, but it wasn't having as tremendous an impact as it did another 10 years later in around 2010, because that first explosion, I would say, was mainly running stunting syndrome. It wasn't the leg problems. So it was more of a vague type of disease expression, and some might have attributed to other infections. But the second explosion that we witnessed in the US around 2012, we started seeing antigenic diversity of these viruses that were causing classic reovirus tenosynovitis. And this, because of the vertical transmission component of this disease, we believe is one reason why it kind of was not just reserved to the US, that it was being seen in other countries where it couldn't have probably spread geographically that quickly. This slide shows just the diversity that I'm talking about. If we're looking at the genotyping and a phylogenetic tree mapping of the spike protein of the Reovirus. First, we have our classic vaccines up here in the square box, and we have genotype 1, which actually has quite a bit of antigenic diversity within it. So we have these variant group 2s over here that can penetrate higher levels of classic antibodies to our classic vaccines. And then we have these other genotypes that are variant viruses. They're not, they don't look like our classic viruses. The question is, how different are they from each other, and how well can one genotype cross protect against another? That much hasn't been well documented, but we do know that there are significant antigenic differences, and the variant group 1 over here is a very good example of that, what we call genotype 5. So things to look for to suspect reovirus immune suppression, and therefore early reovirus challenge, is if you're seeing sizing issues, lack of uniformity starting, as early as 1 to 2 weeks of age in your broiler flocks. Open birds and see ballooning, a lot of liquid contents in the GI tracts. You can see cyst formation in the enterocytes. A lot of times you'll also see in these same flocks, you can see some leg abnormalities. But sometimes, depending on the isolate, it might be more of a viral arthritis type of virus. You might not see the runting and stunting so much, but you might see these splayed legs due to the tendon compromise from the reovirus infections. And this can start as early as 2 weeks of age. And obviously it can happen as late as right as birds are being processed at 5 to 7, 8 weeks of age. This would be what a ruptured tendon, a typical presentation of the classic reovirus would look like. Some of our, like I mentioned, our variant group 2, genotype 5 variant. This is a common presentation for this virus, is you get swelling of the deep digital flexor tendon. So it's a kind of a unique presentation of this type variant reovirus. So that's something that is almost pathognomonic. And you can see the swelling here, and you'll see a lot of lymphocytic infiltrates. So the key to reovirus protection is to have a good solid live priming program of your pullets to not only protect them from reovirus infections, so they're not carriers for life, but to also prime them so that they respond even better once you get into your kill program. And those two strategies together are extremely critical in controlling reovirus in broiler progeny. And that is, again, a good solid live priming program and a good solid breeder program. I recommend 2 killed shots for that. This is an example of not a good program. So you're not getting good response from the first killed reovirus vaccine, and you're not getting a good response to the second reovirus killed vaccine. And what happens, these hens are going into production, they're not even protected themselves from reovirus, and therefore they're seroconverting in production, which is the worst case scenario. The opposite of that is when you get a solid killed IBD vaccine, you get a good response from the first shot, and then an improved response from the second shot, and then you have a more typical decay rate of those titers of those hens in production. And we like to see geometric mean titers of our hen flocks. You know, when they're at 25 weeks of age, we want to see them around 8 to 10,000 for basic reovirus protection. For chicken anemia virus, it's a very stable virus, again, like the others. It replicates in the bone marrow and in the thymus and spleen. And so its main deficits will be in cell-mediated immunity, as well as phagocytic immune response to bacterial infections. Things to look for in clinical signs would be obviously anemia. Hematocrits help diagnose that. You can see pale depressed birds, reduce weight gain. Be looking for this around 10 to 20 days of age, 10 to 15 days of age. Thymic atrophy, gangrenous dermatitis, small thymuses. Look for the timing for small thymuses. If you're seeing that by 3 weeks of age, then you probably you need to rule out CAV as causing an early infection that would have a significant impact on immune response. Pale bone marrow, because you're losing all of those blood cells. Can have also bursal atrophy, because T cells are also an important part of the maturation of the bursa fabricius and helps in its regeneration from being infected. Can have intramuscular hemorrhaging, because the clotting factors the cells that produce those are also impacted, as well as gangrenous dermatitis. Generally, birds are more resistant, or generally resistant after 3 weeks of age, unless they've been infected with another immunosuppressive virus, and that can extend the window of susceptibility. So the way to control this is from the breeder side. And what we want to do is make sure that our birds are seroconverting to CAV in the rearing process, either from natural exposure or to vaccination. And so generally people will want to check their ELISA CAV response, make sure that the pullets are positive for antibodies before they go into production. If they're positive for antibodies before production, they're much less likely to be shedding virus actively while they're in production. Here's an example of a pullet flock that did not respond well to vaccination. You have way too many birds that are negative on antibody response. And so in that case, you would want to test them early enough that you can go back in and revaccinate a flock. So most people will vaccinate at around 10 to 12 weeks of age, look for titer response by 16 weeks, and then if they're not sufficient, go back and revaccinate. And then finally, for adenovirus, another resistant virus. Fortunately, the intranuclear inclusion bodies make it fairly straightforward to diagnose. And again, the timing, if you're having clinical disease by 2 to 3 weeks of age, then there is likely an impact on the immune response of the bird. Vertical transmission is important, but horizontal spread can also be important. So once a flock of broilers becomes infected, let's say vertically, then it sheds all of that adenovirus back into the environment for the next round of place birds. So the ways to prevent this is to, number one, prevent hens from shedding adenovirus in production. And number two, for hens to have high levels of maternal antibodies against those viruses that are more likely to affect them as broilers. And usually in a given area, the adenovirus is presenting in a characteristic fashion. I think in the Middle East, the most typical expression is IBH, infectious inclusion body hepatitis. And so you're more likely to see certain serotypes where you see IBH. And you're looking for characteristic lesions related to IBH. And if you're seeing those by 3 weeks of age, then you need to go back to your breeder program and reevaluate whether or not you have the right antigens present to protect against those conditions. And just a reminder, adenovirus causes atrophy and lymphoid depletion in your primary and secondary lymphoid tissues. So again, underscoring the importance. There are two different strategies that people can take for controlling IBH. I would recommend the vaccine strategy if vaccines are available. Obviously, if vaccines are not available in a market, then the other way to try to control that is to control the exposure of your of your long-lived birds while they're in the rearing period, so they can seroconvert to the to your problematic adenoviruses, and then clear those infections, no longer have the potential of shedding, and pass hopefully high levels of maternal antibodies to progeny. With that, I think I have taken up my time, and I hope this was a reasonable review, and look forward to questions at a later time. Thank you.
Thanks a lot, Kalen, for this very nice presentation, which is to the point, discussing many immune suppressive viral diseases. I believe we received so many questions that we will address by end of the session. Before going to the Arabic translation with our colleague Dr. Ahmed Adel, I believe now we have Dr. Raed Ibrahim, مدير إدارة الصحة والرقابة البيطرية. يعني he would like to welcome all the attendees. So Dr. Raed, the floor is yours.
السلام عليكم.
وعليكم السلام ورحمة الله وبركاته.
إن شاء الله يكون الصوت واضح.
واضح جدا ما شاء الله.
أعتذر عن مش تأخير، عندي technical problem فاضطريت إن أنا أغير الجهاز إلى جهاز آخر، فبدأ الدكتور فما حبيت أن أقطع المحاضرة.
ربنا يبارك في حضرتك. ربنا يبارك في حضرتك. شكرا جدا لحضرتك. اتفضل.
بداية أتقدم بالشكر الجزيل خلينا نقول نظرائنا في الاندستري اللي هو زويتس على الجزئية هذه لموضوع الورش العمل المشتركة. كما أرحب بالحضور. لا يخفى على الجميع ما يحظى به قطاع الدواجن أو بالتحديد الزراعة عامة، وبما فيها قطاع الدواجن من حكومة خادم الحرمين الشريفين وولي عهده الأمين، حيث يسمى هذا القطاع هذا القطاع الجوهري في الأمن الغذائي بما يعادل أو يقدر ب 60% من احتياج السوق السعودي. هذا يعادل 300,000 طن من اللحوم. وتستهدف وزارة البيئة والمياه والزراعة خلال 5 سنوات القادمة أن ترفع هذه النسبة إلى 80% لتغطية الاحتياج السوق المحلي. فهذا يعتبر تحدي جدا كبير للصناعة وللصناع. تطوير صناعة الدواجن حظت بقفزة سواء كانت على المستوى المحلي أو المستوى العالمي. ومثل ما تفضل الدكتور في الورشة هذه، نأمل أن نجمع آراء السيكتورز الثانية اللي معانا في البزنس أو بزنس الدواجن فيما يخص الأمراض التنفسية والاستراتيجيات الوقاية فيها. وكما هو من المعلوم أن الأعراض التنفسية في الدواجن تعود لمسببات كثيرة، سواء كانت بكتيرية، فيروسية، فطرية، أو مشاكل في التربية. نأمل من خلال هذه الورشة أن تتاكل الإيشوز أو نضع أصابع الاتهام إلى ما ممكن عمله جميعا، سواء كان ممثل في وزارة البيئة والمياه والزراعة أو في القطاع الخاص. شكرا لكم، يعطيكم العافية.
شاكرين جدا لحضرتك دكتور رائد على هذه الكلمات الأكثر من رائعة. طبعا عايز أقول لحضرتك يمكن اختيارنا للمواضيع النهاردة فيما يخص التثبيط المناعي وعلاقته بالأمراض التنفسية المعقدة، لأن ده فعلا حقيقي موضوع حيوي جدا جدا. يمكن احنا مشاكل التنفسية بتقابلنا وبنبدأ إن احنا نتجه لبرامج التحصينات والرعاية فيما يخص المشاكل التنفسية الفيروسية بشكل مباشر، ولكن في موضوع مهم جدا، أنا ممكن يكون بستخدم أفضل تحصينات في الدنيا وعندي أفضل مانجمنت، ولكن ممكن يكون بعض المسببات اللي هي بتثبط المناعة لها دور كبير جدا جدا في إحداث هذه المشكلة. فعشان كده كان ده فعلا الاختيار لهذا الموضوع. واعتقد دلوقتي احنا وعندنا الوقت اللي زميلنا العزيز دكتور احمد عادل ان هو يعمل لنا سمري يعني على قد ما يقدر في اقل وقت ممكن للسيشن الاولاني او الاول الخاص ب كالين كوكسون. دكتور احمد، the floor is yours.
السلام عليكم دكتور حسين. سامعني؟
سامع حضرتك جدا يا دكتور، سامع حضرتك جدا. وشايف السكرين، شايف السكرين بالظبط بالظبط. اتفضل.
في البدايه حابب اشكر الدكتور رائد على حضوره الكريم، ودكتور حسين، واتفضل بالشكر لجميع العملاء الكرام على حضورهم لهذه ورشه العمل، وان شاء الله تكون بافاده ليكم باذن الله. طيب، فيما يخص البرزنتيشن الخاصه بالدكتور كالين، كان اتكلم فيها عن دور الفيروسات المثبطه للمناعه وعلاقتها بامراض الجهاز التنفسي بالدواجن. طيب، زي ما حضراتكم عارفين ان صناعه الدواجن بتتعرض لمشاكل تنفسيه دايما بتبقى مختلطه مع بعضها، زي ما الدكتور رائد قال من شويه ان بيبقى في مشاكل بكتيريه، في مشاكل فيروسيه، في مشاكل برضو بتبقى داخل فيها برضو الاميون سبريشن. وده كان الكور بتاعنا، ان احنا عارفين ان الاميون سبريشن واحد من الاسباب اللي بتسبب لي مشاكل الريسبيراتوري ديزيز كومبلكس، وتبان فيها الريسبيراتوري كومبلكس بزياده. كان الدكتور كالين اتكلم عن الجهاز المناعي، ان طبعا احنا عندنا في الجهاز المناعي في جهاز اللي هو المركزي او البرايمري او الاولي اللي هو باللون الاحمر، اللي هو عباره عن الثايموس اللي هو الغده التيموسيه، وفي الغده الفابريشيوس اللي هو البرسا، وعندنا النخاع العظمي. الغده التيموسيه مسؤوله عن الخلايا البائيه، الغده الفابريشيوس وهي مسؤوله عن الخلايا البائيه، والبون مارو بيبقى ليه دور في الخلايا البائيه برضه والخلايا التائيه. في برضو أنسجة أخرى اسمها الأنسجة الثانوية أو الطرفية، اللي هي بتبقى موجودة عندك في الجهاز التنفسي أو في الأمعاء أو في السيكال تونسل في الأعورين، وممكن برضو تبقى موجودة في رأس الطائر في الهاردريان جلاند أو في ملتحمة العين. باختصار شديد، احنا عندنا أهم حاجتين عندنا، اللي هو الخلايا البائية المنتجة من البرسة، المينلي من البرسة، وعندنا الخلايا المنتجه اللي هي التائيه منتجه من الغده التيموسيه، ودي اللي هي بتلعب دور المناعه المكتسبه جوه الطائر. طيب، بالنسبه للمناعات المختلفه اللي عندنا فيما يخص الامراض التنفسيه، عندنا في مناعات احنا سميناها مناعات سائله او الدمويه، اللي هي عباره عن اجسام المضاده اللي طالعه من الخلايا البائيه لغده الفابريشيوس. دي ممكن تكون مثلا في حاله مرض نيوكاسل والانفلونزا مناعات دمويه، تمام، بتبقى موجوده في دم الطائر عن طريق ان هو اتحصن او تعرض او الامهات نزلتها للصيصان المختلفه. برضو في عندك الاجسام مضاده اللي هي الموضعيه اللي بتبقى موجود في الاغشيه المخاطيه، تمام، دي برضو بتلعب دور كبير جدا في حاله النيوكاسل والالتهاب الشعبي المعدي. في مناعات خلويه منتجه برضو من الخلايا التائيه، دي اسمها السيل ميديتد اميونيتي، ودي بتلعب دور مهم جدا في الالتهاب الشعبي المعدي والتهابات الحنجره والقصبه المعدي والايكولاي والميكوبلازما والنيموفيروس. تمام. حمايه غده الفبريشس والغده التيموسيه امر ضروري جدا علشان الاستجابات المناعيه في حاله التعرض او التحصين او الاثنين معا. لو حصل فيه اي اميون سبريشن انت بالنسبه لك التحصين اللي انت بتحصنه ملوش اي جدوى ولا هيبان عندك، وبالعكس كمان هتزيد عندك العدوى وتسبب مشكله كبيره جدا. ده باختصار شديد ان كل ديزيز ليه المين ارم او الذراع اللي بيسيطر عليه في البروتكشن او الحمايه بتاعته. في نيوكاسل في اللي هو ذراع الايه الانتي بودي او الاجسام المضاده، وزيه برضه في الانفكشوس بيرسل ديزيز اللي هو الجمبورو والريو والكلام. في حاجات ثانيه بيبقى فيها الاثنين الذراعان الاثنين اللي هو السيل ميديتد او الخلويه، المناعه الخلويه ومناعه الاجسام المضاده زي في حاله الانفكشوس برونكايتس والسالمونيلوزيس والكوليباسيلوزيس. في مناعات ثانيه اللي هي المناعه الخلويه هي المسيطره في الوقايه ضد الملك، مش الانتي بودي اميون ريسبونس، والميكوبلازما نفس الكلام، والفاول بوكس والانفكشوس والانتروكايتس. طيب زي ما قال الدكتور كالين ان عندنا الامراض الفيروسيه المختلفه اللي بتسبب التصبيط المناعي هي اكتر حاجه عندنا هو ما فيش ابيض واسود فيها، لكن في حاجات بتبقى فيها تاثير اضغى في التي سيلز اللي هي الخلايا التائيه، وفي مثلا فيروسات اخرى بتبقى عندها دور اكبر في الخلايا البائيه. فاحنا عندنا مثلا التشيكن انيميا بتاثر على النوعين من المختلفين من الخلايا من التائيه والبائيه، ولكن الماجوريتي او الاكثر في الخلايا التائيه، على عكس الجمبورو. في حاله الجمبورو الخلايا البائيه بيحصل لها تتكسر وبيحصل لها ديجنريشن وليمفوسيتك ديبليجن، فبالتبعيه بيبقى، لكن برضه هي ليها دور برضه على الخلايا التائيه. نفس الكلام المرك برضه بيلعب الدورين ولكن اكتر عن الخلايا التائيه. في حاله الريو برضه بيلعب نفس في برضه بيأثر على البي سيلز، والادينوفيروس بيأثر على البي سيلز، ولكن برضه ليه دور برضه في التي سيلز. هو ما فيش ابيض واسود في الموضوع، ولكن في مناعات يعني في تاثير مثبط اكتر على الخلايا التائيه في بعض الفيروسات عن بعض الفيروسات الاخرى الخلايا البائيه. طيب زي برضه الدكتور كالين اتكلم ان كل بريد، مثلا احنا عندنا طيور لاحمه، طيور امهات، وفي بياض. طبعا في الطيور اللي هي بتبقى مثلا اللحم البياض والامهات بيبقى دي بتعيش لفترات طويله، ففيها التندنسي او القابليه ان تحصل فيها اورام كثيره زي الملك. طبعا الجمبورو مرض مهم جدا في الثلاثه بريدز نفسها سواء لاحم او بياض او امهات. في حاله الريو والتشيكن انيميا والادينو كان الاهم في اللاحم، ولكن برضه هي برضه بتيجي للبريدرز واللايرز. وفي مهم جدا كلما كانت الاصابه مبكره من هذه الفيروسات كان التاثير عميق، يعني لما يكون اصابتها بدري يكون هي تاثيرها عميق، ولو كمان لو اختلطت ببعض، يعني ممكن يكون تشيكن انيميا مع جمبورو في نفس الوقت، بيبقى بيديك هنا زي سينرجيزم، او يعني الايفكت بتاعها بيبقى اعلى. تمام. طبعا الدكتور كالين كان بيتكلم عن الجمبورو، وطبعا زي ما حضراتكم عارفين في مشاكل برضه بتسببها ان هو بيعمل ليمفوسيتك ديبليشن في الخلايا البائيه اللي موجوده، فبيحصل هنا الاتروفي باختصار شديد. طبعا احنا عندنا هنا في منطقتنا ما عندناش الفاريانت جمبورو، عندنا الفيري فيرولنت وعندنا الكلاسيكال. طبعا زي ما الدكتور كالين اتكلم ان احنا لما بيجي الانفكشن قبل ال 21 يوم بيديني بيرمننت اميون سبريشن علشان بيكون مكسر لي وعمل لي توتال او يعني ديبليشن للبي سيلز الموجوده في البرسل. في حاله لو حصل الدخول الفيروس بعد 21 يوم بيحصل لي تمبرري اميون سبريشن، وطبعا لو دخل معاه امراض اخرى بيسبب لي ديبريشن ويسبب لي النافق اللي حضرتك بتشوفه. طبعا التاثير العدوى المبكره من فيروس الجمهوري طبعا بالتبعيه بتاثر تاثير مهم جدا على المناعات اللي طالعه او الكونسنتريشن او تركيز المناعات من تحصينه النيوكاسل، وكذلك برضو بتاثر على البروتكشن والحمايه ضد الالتهاب الشعبي المعدي. ده معناها ان لما بيحصل اميون سبريشن بيأثر لي على الاستجابات المناعيه وبرضو على البروتكشن ضد الامراض المختلفه. القطعان المثبطه مناعيا بواسطه الجمبورو طبعا زي ما احنا قلنا بتسبب مشاكل في الاستجابات المناعيه، بتبقى متدنيه، اكثر عرضه للامراض الاخرى والاصابات الثانويه زي الايكولاي. طبعا بتسبب طبعا بتزيد معاملات التحويل العلفي، بتسبب زياده استبعادات والفرزه والاعدامات في المسالخ. بالنسبه للقطعان البياض بيحصل تدني في انتاج البيض وتزيد من عدم التجانس القطيع. طبعا زي ما الدكتور كالن قال ان احنا في مرض الجمبورو هو مرض التوقيت، يعني معناها امتى هتخش بالتحصين في الوقت المناسب، علشان لو دخلت بدري ممكن يحصل ان التحصينه بتاعتك تفقد فعاليتها، ولو جيت متاخر دخل عليك العتره الحقليه ودخلت عملت كولونايزيشن او عششت جوه البرسه بتاعتك وكسرت لك البي سيلز، وبالتبعيه ما اصبحش ليه فايده التحصين بتاعك. فهو لعبه التوقيت في الجمبورو. اتكلمنا برضو ان هنا توقيت حدوث العدوى من فيروس الجمبورو في وجود مستويات مختلفه من المناعات الاميه. بناء على نسبه التعرض يعني او شده التعرض الهاي يعني هاي فيلد تشالنج ممكن يخش على البرسه اسرع من اللو فيلد تشالنج. تمام. فطبعا مهم جدا تبقى عارف التترات المناعيه اللي عندك ايه، وتبقى عارف برضو ايه السيركيوليتد او التترات اللي موجوده عندك في المنطقه، هل هي فيري فيرولنت ولا كلاسيك، عشان تبقى عارف امتى بتخش على البرسه وتلحقها عشان تعمل الاكتيف اميونيتي. طيب دي ببساطه شديده اللعبه بتاعت الجمبورو. زي ما حضراتكم عارفين ان في ماتيرنال انتي بوديز بيحصل لها نزول مع الوقت، لو انت ما حصنتش في الوقت المناسب هيحصل عندك اميونولوجي جاب، هيحصل عندك فجوه مناعيه فانت عايز تعوضها. زي ما الدكتور كالن اتكلم برضو ان احنا على حسب شده التعرض بتاعنا بنقدر ندي يعني التحصين في الوقت المناسب. انا هحاول اوجزها ببساطه شديده عشان ما اعيدش الكلام. طبعا في حاله لو انت عندك برنامج متواضع في الامهات وبرنامج برضو متواضع زي ما بيقولوا في حاله البرويلرز، بالنسبه لك في اللود تشالنج انت تقدر تتحكم فيه بسهوله جدا باللقاحات العاديه الكونفنشنال فاكسينز. في حاله طبعا لو عندك مودريت جمبورو تشالنج الجاب عندك بتبقى في الاسبوع الثاني والاسبوع الثالث، فانت بالتبعيه عايز تقفل الجاب دي الاسبوع ده، لانك لو اتاخرت ممكن يخش العتره الحقليه. فبالتبعيه زي ما الدكتور كالن قال ان انت ممكن تستخدم الاميون كومبلكس او تستخدم الفيكتور فاكسينز علشان تقفل الجاب دي بسرعه قبل ما يخش عليك عتره حقليه. وقال اهم حاجه انك انت تستثمر في اللقاحات بتاعه الامهات، يعني باختصار شديد تستثمر في لقاحات الامهات، لان لما بيكون عندك سترونج بريدر بروجرام ده بيامنك من ضد كل اللو تشالنج او التعرض البسيط او المتوسط او العالي. طبعا زي ما اتكلمنا في لقاحات كونفنشنال او اللي هي العاديه المتوسطه وفوق المتوسطه، ودي لقاحات مهمه جدا بتستخدمها على حسب شده التعرض الحقلي. في لقاحات الجمبورو اميون كومبلكس، ودي برضو لقاحات مهمه جدا بتستخدم في الفقاسه او بتحقنها عن طريق مكن حقن البيض في الهاتشري برضو. وفي برضو لقاحات الجمبورو المحمله على مرك، ودي برضو حضراتكم بتستخدموها في التحصين برضو عن طريق الحقن عمر يوم في الفقاسه او عن طريق الانوفو انجكشن. كل حاجه ليها مزايا وكل حاجه ليها عيوبها. طيب بالنسبه للمارك ديزيز فيروس، طبعا الدكتور كان بيتكلم عنه من وجهه نظره ان هو من امريكا. طبعا احنا بالنسبه لنا لان احنا بنربي عندنا هنا في السعوديه لمده يعني ممكن 28 30 يوم، طبعا فرصه ان الحدوث عندنا مشاكل المارك ما بتبقاش كتيره بالمقارنه بامريكا. ممكن يبقى عندهم قطيع اللحم يوصل 8 اسابيع تربيه، فبالتبعيه انت ما بتحسش بمشكله المارك دي. ولكن لو انت ربيت قطيع حوالي 5 اسابيع ممكن يبقى عندك برضو مارك ويعمل اميون سبريشن. طيب برضو مش عايز ادخل ان ديتيلز، لكن الدكتور كالين قال ان مشكله المارك ممكن لو في هاي تشالنج في اللاحم، طبعا لما بيكون تربيته لفترات طويله ممكن تصل الى 8 اسابيع، ممكن هنا تظهر عندك اعراض ليكوزس وتتبان عندك تيومرز، وبالتبعيه بتسبب لك كوندمينيشن. هناك في امريكا طبعا بيحصنوا بيعملوا فاكسينيشن للبرويلرز لان عندهم تندنسي للريسك، عندهم قابليه للريسك ده، وطبعا بيحصنوا برضو اللونج ليفنج بيرد اللي زي البياض والامهات برضو بلقاحات مريض. طيب فيروس الريو طبعا من الفيروسات المهمه جدا، شديد التحمل للظروف البيئيه اللي عندنا، معدي جدا، بينتشر بسرعه سريعه جدا في العنبر. القابليه للعدوى في عمر اول اسبوعين، وبتزيد طبعا لما بتكون العدوى مبكره، كل ما بيكون التاثير السلبي للاميون سبريشن عالي جدا. تمام. الاستراتيجيه طبعا زي ما الدكتور كالين اتكلم ان احنا هنا بنركز على القطعان الامهات بتحصينها عشان تمنع عندي الشيدنج او الافراز اللي بينزل مع الصيصان، او ان انا بحاول انزل مناعات اميه مع الصيصان تبقى دي تعملها بروتكشن في الفتره الاولانيه. طبعا من الحاجه المهمه جدا نبقى عارفين ان احنا بالنسبه لوبائيه الريو لازم تبقى عارف العترات المنتشره عندك، لان في انماط مختلفه جدا من الريو، وليه الانماط المختلفه دي وعترات مختلفه زي ما الدكتور كالن شرح هنا، وقال لك ان في ميني جينوتايبس، في فاريانت سترينز. دي بالتبعيه لازم تبقى عارف انت عندك ايه عشان تقدر تختار التحصين المظبوط وتدي برنامج امثل للامهات، اللي بالتبعيه هيديك مناعات للصيصان ويمنع الافراز مع الصيصان للريو، تبقى مشكله ريو. تمام. طبعا ده الكلينيكال برزنتيشن او الاعراض الاكلينيكيه. طبعا في تقزم وفي مشاكل بتبان عندك، وعدم تجانس في الاوزان، وسحب علف بدون اي عائد. نفس الكلام هنا في اليمين عندك اللي هو نورمال انتستين، الامعاء السليمه. هنا الامعاء بيبقى فيها ديستندد بالووتر، مليانه ميه كتير وبتبقى شاحبه. طبعا بيحصل طبعا قله الامتصاص بسبب طبعا التاثير على الفيلاي اللي موجوده في الانتستين. طبعا في مشاكل عرج، احنا قلنا ان هو ليه انماط مختلفه في انماط مرضيه مختلفه، فانت لازم تبقى واخد بالك من الحاجات دي. وبيسبب مشاكل برضو في التندونز والاوتار، وزي ما حضراتكم شايفين برضو بيبقى هيحصل سماكه في الاوتار ويحصل لمنس وعرج في الطيور. طبعا البرنامج الافضل للتصدي لمشكله الريو طبعا انك بتدي تحصينتين برايمنج لايف، ثم بعد ذلك بتدي تحصينتين عند عمر 10 12 ويك ان اكتيفيتد فاكسين، وعند عمر من 18 19 20 ويك ممكن تدي تحصينات ثانيه، فتدي 2 حي و2 ميت علشان يديك مناعات تغطي وتنزل المناعات دي للصيصان وتوقف الشيدنج بتاع الامهات ان تنزل الفيروس مع كان الدكتور كالن اتكلم برضو ان التحصين الكويس والامثل هو اللي بيديك مناعات فوق ال 8000 اللي بيأمنك. طبعا الطبيعي عندك ان لازم بعد ما اديت التحصينتين الكيلد بيرتفع المناعات، بتبتدي يحصل ديكلايننج. ده طبيعي جدا لان طبيعي بتنزل مع الوقت، على عكس البرنامج هنا لما ما يدكش مناعات كويسه في الاول ويبتدي يحصل انكلاين ويطلع لفوق، معنى ذلك ان حصل عندك اصابه وابتدى يحصل افراز للفيروس، والكيلد فاكسين بتاعتك ده ما حصنش الامهات وما نزلتش مناعات الاميه المظبوطه. طيب بالنسبه للتشيكن انيميا، فيروس الانيميا طبعا من الامراض المهمه جدا في التثبيط المناعي للخلايا التائيه وبرده الخلايا البائيه. ليه نمط مصلي واحد واداراته ما بتختلفش كتير بين العترات او المعزولات المختلفه. برضه بيتحمل ظروف مناخيه عاليه جدا، بيأثر زي ما احنا قلنا على الخلايا التائيه من الغده التيموسيه والخلايا البائيه برضه، والخلايا التائيه اللي موجوده بالطحال والنخاع العظام الهيموسيتوبلاست والماكروفيجز. تمام. الاعراض الاكلينيكيه برضه بتظهر بعد الفأس، بالذات بتوصل عند العمر الثامن ولحد العمر ال 12، وممكن تصل ذروتها عند عمر 14 و16 يوم. طبعا ده لو في حاله ان المناعات الاميه مش كويسه والامهات نفسها بتفرز الفيروس مع الصيصان. تمام. طيب برضو الاعراض الاكلينيكيه بتاعته بتظهر برضو ان هو الطيور ديبريسد ومعامله التحويل بتقل، بيحصل جانجرينس ديرماتيتس، التهاب غنغريني، بيحصل كومبليكيشن مع الايكولاي، وتمام برضو بيحصل برضو tumor في الغده التيموسيه، وبيبقى طبعا البون مارو او نخاع العظام بيحصل فيه بهتان لان دي اعراض انيميا. تمام. وبرضه بيحصل اتروفي او اضمحلال في النخاع العظام، واضمحلال في غده فابريشيوس. تمام. برضه بيحصل من الحاجات المميزه ليه ان هو بيسبب بعض الانزفه تحت الجلد وفي على العضلات، وزي ما حضراتكم اتكلمنا من شويه عن الالتهاب الغرغريني في الجلد، برضه بيبقى برضه من الكاركترستكس او مميز للتشيكن انيميا. طبعا هو كل ما بيكبر عمر الطائر، تمام، بعد 3 اسابيع بيبقى في ان هو في مقاومه من انواع الايج ريزيستنس، يعني معناها كل ما بيزيد العمر كل ما بيحصل ريزيستنس او عدم قابليه للمرض، ولكن ممكن تتاخر القابليه دي ويحصل ان الطائر يحصل له اصابه لو هو مختلطه بفيروسات اخرى. يعني مثلا لو جت مالك كمان وريو وجمبورو، ده بيطول الفتره اللي ممكن يحصل فيها التشيكن انيميا يصاب بها القطيع. تمام. نفس الكلام برضو ده الاستراتيجية بتاعتنا هنا، ان لازم الامهات تكون متحصنة كويس علشان ما تفرزش الفيروس مع الصيصان، وبرضو تنزل مناعات امية للصيصان تقدر تتصدى بيها الفترة الاولانية من عمرها. دي برضو نفس الكلام اللي اتكلمنا فيه من شوية. طبعا احنا في حاله التحصين لازم احنا بنحصن عند العمر العاشر او ال 12 اسبوع، الاسبوع العاشر او الاسبوع ال 12. طبعا لازم بتعمل مونيتورنج او بتشيك بالالايزا وتشوف المناعات اخبارها ايه. طبعا لو وجدت ان اقل من 80% من القطيع مش محصن فبتعيد التحصين تاني. وانت ما بتيجي تشيك بالالايزا لازم تدي الاول فرصه للقاح يشتغل لمده 4 اسابيع، وبعد كده تدي تشيك بيه وتشوف هل محتاجين تاني نحصن من تاني ولا لا. تمام. بالنسبه لفيروس الادينو من الفيروسات طبعا اللي هي بتستحمل الظروف المناخيه الصعبه. في مميز ليها ان احنا بيظهر عندنا في الانسجه حاجه اسمها انترنيوكلر انكلوجن بوديز. فيروس الادينو العتره المصليه رقم 1 ده المنتشره بكثافه في قطعان اللحم والامهات. برضو العدوى الرئيسيه تعتبر هي اهم حاجه. طبعا في عدوى افقيه ممكن تحصل برضو، لكن العدوى الرئيسيه لو الصيصان دي جايه من مصدر من امهات بتعمل شيدنج للفيروس في الصيصان، دي مشكله كبيره جدا. بيعمل برضو مشاكل في الكبد زي ما احنا قلنا، وبيعمل برضو ضمور في غده الفبريشوس ويزود النفوق، وليه انماط مصليه مختلفه، ودي برضو بتخلي مشكله التحصين بتاعته هل هو ذا جدوى ولا لا، نظرا للاعتراضات المنتشره في كل منطقه مختلفه. طبعا في كلاسيفيكيشن للفاول ادينوفيروس، هو 5 انواع A B و C D و E، وفي 12 سيروتايب. وزي ما حضراتكم شايفين احنا زي ما الدكتور كالن قال ان اكتر واحد موجود في الميدل ايست، وده احنا بنشوفه كلنا قدامنا، اللي هو الانكلوجن بودي هيباتيتس. تمام. وبيسبب اتروفي او اضمحلال في الانسجه المركزيه والانسجه المركزيه او الثانويه من من الليفويد اورجانز. طبعا الوقايه ان احنا اهم حاجه عندنا طبعا الامن الحيوي والتحقق من مصادر بيض التفريخ. طبعا لو متوفر زي مثلا في استراليا في بعض اللقاحات الحيه للادينو متوفره، فممكن اللي هي تستخدمها. في لقاحات ميته بتقدر برضو تستخدمها اثناء التربيه للامهات، بحيث ان هي يعني تحفز المناعات الاميه للصيصان وتمنع افراز الادينو للصيصان. طبعا في برضو ناس كتيره جدا او شركات كتيره بتستخدم اللي هو اللقاحات المصنعه زي تاني المنشا او اللي يطلق عليها الاوتوجينوس فاكسين او سب يونت فاكسينز، برضو ممكن تستخدم، وده بالنسبه للوقايه. واشكركم، حبيت بس ابقى ادي سمري سريع عشان ما اطولش عليكم. شكرا جزيلا.
شكرا دكتور احمد، يعني كان سمري اكثر من رائع. في طبعا بعض الاسئله اوريدي موجوده، ويمكن كان في الكويشن اند انسر تشات بوكس كان دكتور كالن اوريدي انسرد او جاوب على بعض الاسئله، ولكن برضو في نهايه السيشن ان شاء الله حتى الاسئله اللي هو تم اجابتها على الشات بوكس ان شاء الله هنبدا ان احنا نتناقش فيها في نهايه السيشن ان شاء الله. دلوقتي احنا بنتكلم على السيشن الثاني. So we are going to our next speaker, Dr. Rita Wipper, our poultry veterinary expert at Zoetis in Germany. She will going to talk about control of Colibacillosis in poultry industry as one of the complicating agents, for most of the respiratory disease, not only in Saudi Arabia, but in all Middle Eastern countries. So just a brief introduction about Dr. Rita. Dr. Rita, she has been working as a research associate at the Institute for Food Hygiene in Faculty of Veterinary Medicine in Gießen, Germany. Then by 1999 until 2005, she has been working as a research associate at the Clinic for Poultry at University of Veterinary Medicine, Hanover Foundation in Germany. Then from 2005, Dr. Rita had some positions in the technical service and the clinical affairs at different pharmaceutical companies in Germany. From 2011 until present, Rita working as poultry veterinary expert at Zoetis, Germany. Welcome, Dr. Rita. Now the floor is yours.
Yes, thank you very much. Dr. Hussein, can you hear me?
Yes, very well.
Okay, thank you. So thank you very much for inviting me for your seminar. And that I get the opportunity to talk about control of Colibacillosis in poultry. As you know, it's one of the major economical issues we have in the poultry industry today. And in many countries, we cannot use antimicrobials prophylactically anymore. And so we only cannot use growth promoting agents in some countries anymore. And in older birds, we see a shift of bacterial population in the bird towards Enterobacteriaceae. And especially in our genetics nowadays, we also see some bacterial translocation through tight junctions. And all these factors contribute to this big, wide symptom complex you probably see every day. And antibiotics are not first choice anymore. And so the WHO wants us to stop using antibiotics in healthy animals to prevent the spread of antimicrobial resistance. That is one issue we have with E. coli, but we also have a second issue. And that is, I only want to touch it very briefly. We see in the literature that APEX are being discussed more and more as cause of zoonosis in humans. And so we really have to be ready. We have to have the right tools to fight APEX in poultry. So what are APEX actually? Looking at E. coli, we differentiate between commensals. There are true commensals, and we have commensals that are potentially pathogenic. It depends on outer factors. Then we have the pathogens, true pathogens. And here we differentiate between the intestinal ones and the extraintestinal ones. For the intestinal ones, it is very easy to define and to identify them. Mostly you can do it by host, by clinic, by virulence genes. For the extraintestinal E. coli, and you see here are not only the APEX, here are also the UPEC and NMEC, and they are the ones that cause, for instance, urinary tract infections in humans or newborn meningitis. For them, it is not easy to characterize, and we do not have routinely established procedures to find out whether in E. coli is an APEC or not. But for control, you need to know your enemy, right? And that is why we decided to have a closer look into clinical isolates, and we started molecular typing. So we looked into sequence types and found out that APEX are highly diverse. We looked into phylo groups, and we found that the so-called B2 strains are associated with layers and non-B2 strains with broilers. And we saw that Colibacillosis in broilers is often multifactorial and caused by opportunistic strains that differ from typical APEC. When we looked at serotypes, we also saw that they are very diverse and that certain serotypes may be surrogates for sequence types. So for instance, the O78 serotype may be a surrogate for sequence type 117 and sequence type 23. We also looked into a very high number of different virulence-associated genes. And we saw the highest number of virulence genes among these B2 strains. And we could conclude that these B2 APAC possess primary pathogenic potential. And if we look in addition at phylogroup group and sequence type, we saw that this might be a good tool to predict the virulence potential of APACs. Well, I said it is important to know our enemy in order to fight APACs. And of course, you need to have tools in place to fight APACs. And a few years ago, we launched a live E. coli vaccine that is meanwhile used all over the world. And that is a live ARO-A gene deleted E. coli strain. This deletion of the ARO-A gene means that this vaccine is not able to produce aromatic amino acids anymore, and therefore it can also not replicate to a high extent, and it cannot form a self-sustaining population, and it just causes, after it has induced immunity, a self-limiting infection. Well, I just showed how diverse this E. coli population is, what we find outside in the field. And so it was for us, of course, very important to prove that the vaccine offers broad cross protection. And therefore, we initiated several trials. Here, birds were vaccinated with a live E. coli vaccine either at day 1 or in a second group at day 1 and day 18. And at day 42, they were challenged either with challenge strain belonging to serotype 01 or 02 or 18. And then an erythrocytosis scoring was conducted. And as you can see here is in the non-vaccinated control, we had high erythrocytosis scores. And that was reduced in the birds that were once vaccinated, but even more pronounced in the birds that received the live E. coli vaccine 2 times. Well, I just mentioned that there are different ways to characterize E. coli. And so it was also important for us to look at challenge models where we did not characterize the challenge strain just by serotype, but also by sequence type, the virulence genes, and the in vivo virulence that we had determined previously. In this trial, we had SPF birds, and they were vaccinated at day 1, and in a second group at day 1 and in week 8 of life. And in week 10, they were challenged with these different challenge strains. Here you see the mortality after challenge. In blue, we see highest in dark blue, we see highest mortality in birds that were not vaccinated. And in medium blue, you see the birds that were once vaccinated, and in light blue, the birds that were twice vaccinated. And here you see the characteristics of the different challenge strains concerning sequence type and serotype. And we also tested more strains than these 3 here, And when we looked at mortality, considering all different challenge strains, we saw we got this nice result where we saw highest mortality in the non-vaccinated, followed by the ones vaccinated, and best results here in the birds that were 2 times vaccinated. Here we only showed the results for the challenge strains that belonged to the highly virulent B2 sequence type 95 strains. And these data are not shown. We also saw in the vaccinated birds a decrease of tissue organ score. So we did this in addition. And Dr. Cookson already mentioned that we see after E. coli vaccination some kind of cell-mediated immunity that is very important here. And in this trial, we looked at antibodies. And we found that the vaccinated birds had increased levels of not only IgY, but also increased levels of IgA. And IgA is actually the primary mediator of adaptive immune response on mucosal surfaces in birds. And that also may be a crucial factor for the prevention of APAC infections. I come now to the Colibacillosis in fattening birds, so broilers, turkeys. We just heard that these birds can be very often immunocompromised. They can be infected with all different viruses. They can be stressed, either cold stress or heat stress. And in these birds, opportunistic secondary infections occur more often. And that is why we see in broilers quite a huge variety of different diverse isolates. So what can we do? Of course, we can improve keeping conditions. We can improve hygiene and management. Here you see cilia in the trachea, and you see here that the cilia are destroyed. It can be by dust, it can be by ammonia, it can be by previous primary viral infections. And that is how it should look like. So it is very important, and I think that was stressed in the first presentation, that vaccination schedules must be tailor-made. And for instance, regarding IBV, you need a constant monitoring of the specific field challenge you have on your farms, and it may require also a constant adaptation to this specific field challenge. But in addition to that, we can, of course, do something against these secondary E. coli infections. We can specifically immunize against this bacterium. And well, now I would like to share with you some results, what we had after using the live E. coli vaccine. So this here are results from the US. These trials have the big advantage in comparison to European trials that they cover so many millions of birds, what really makes also the results very valid. So this here was a complex that saw a rise in respiratory disease, and then they started to spray over 4 million chicks with this live E. coli vaccine at hatch and compared it with non-vaccinated flocks. The controls received gentamicin in ovo, but the live E. coli vaccinated flocks did not. Well, you see here the first week mortality that was lower in the non-vaccinated controls, but please keep in mind that these birds received an antibiotic, whereas the live E. coli vaccinated birds did not. But what is really important is to look at remaining mortality. And here we see, well, it turned totally, and the vaccinated birds showed a lower mortality in comparison to the birds that were not vaccinated but even received antibiotics. And when we look at the percentage of birds that needed treatment, we saw that that were only 20% in the live E. coli vaccinated birds, but 36% in the non-vaccinated birds. And also regarding duration of treatment, that could be drastically reduced from 6.8 days in the non-vaccinated birds to 2.6 days in the vaccinated birds. And in addition, we saw in the live E. coli vaccinated birds less condemnations and a better feed conversion. These are results from North Africa, and they were conducted on a farm with a long history of high E. coli related mortality. And here two houses of 8,000 broilers were compared. All birds in this case were given in ovo antibiotic, but the controls received in addition enrofloxacin for the first 3 days of life. And the trial group was sprayed at 3 days of age with the live E. coli vaccine. And what we see here, in the first week, we still see an advantage for the group in blue that received enrofloxacin. But then over the entire keeping period, we see that the mortality in the enrofloxacin treated farm increases, whereas the mortality in the farm that were vaccinated decreases. And in addition, again, we had a better feed conversion in the vaccinated flocks, and we had heavier birds too. These are results from Germany, where susceptible birds were vaccinated. So what are susceptible birds? These are birds that are hatched from old eggs, and that means that these eggs were stored after laying more than 8 days. And normally this integration would store these eggs only for 3 to 4 days. In addition, was the parent stock in a quite high production week. And so the vet started to vaccinate these birds with this live E. coli vaccine at hatchery, and compared these birds to unvaccinated birds. And here you see the results. The mortality could be decreased from 3.1 to 2.7%. The condemnation rate could be decreased from 1.4 to 1.8%. And in addition, the birds that were vaccinated with the live E. coli vaccine needed less antibiotic treatments. This is a trial from France. They had a different issue. They saw a recurrent high rate of condemnations due to cellulitis. And they produced 700,000 broilers per week. And so they also started to use live E. coli at the hatchery and compared then the results to birds that were not vaccinated. And here you see that the total rate of condemnation could be reduced for 80% in the live E. coli vaccinated birds. Well, and of course, additional vaccine always costs some money. And that is the point where you should calculate your return of investment. And this here is an example. This French company just looked at the profit concerning condemnation, the profit concerning mortality, the reduced use of antibiotics, and the savings in feed. And so they calculated this and then looked at the cost of vaccination. And they found out that whenever they face a condemnation rate more than 2%, it is worthwhile to vaccinate with the live E. coli vaccine, because in that case, it pays well back. This is another very, I think, interesting finding, what I would like to share with you. And this is something what Dr. Hussein had previously shown under experimental conditions. And we did the same in Germany, well, without knowing about this lab trial in the field. So we compared lincospectin treatments for the first 3 days of life versus this treatment plus live E. coli vaccine. So we had a farm. This farm had 8 houses with 37,000 broilers. So that is, for German conditions, quite a big complex. And they slaughter around 44 days. And we had 2 different vaccination schemes. And that was, as I mentioned, lincospectin for the first 3 days. That is a metaphylactic approach commonly used in North Germany whenever they have bad chick quality, and really a problem is also caused by enterococci infections. And in the second, so 18 flocks were treated like this, and in 8 flocks, this early lincospectin treatment was followed by a live E. coli vaccination between day 12 and 16. And whenever further antibiotic treatment was indicated, it was also applied and given. And here are the results. We see here in orange the 7-day mortality in the birds that got lincospectin for the first 3 days. And here the 7-day mortality in the birds that also received the vaccine in addition. You see, it could be 7-day mortality could be reduced from 1.6 to 1.2%, and the total overall mortality from 2.8 to 2.0%. Regarding condemnation, we have also a very good result in the birds that received also in addition the E. coli vaccine. So the condemnation was 0.42, whereas it was in the only treated antibiotic treated birds 0.58. The weight of the birds, final weight, was also better in the birds that received the E. coli vaccine. And in addition, I'm not showing these results, we also had less use of antibiotics in the birds that got this metaphylactic lincospectin treatment followed by live E. coli vaccination. Okay, so what are actually the conditions for the use of a live E. coli vaccine? We also need, in addition, good water hygiene, good farm hygiene, litter management, ventilation. I just showed you the trachea. litter management, also regarding coccidiosis. Here you see gut pictures. That should be optimal. We need a good overall vaccination scheme, so that was also addressed. And you should please consider not to have any antibiotic residues in the water system. So these are all factors we can control, but there can still be situations where we see high field pressures due to agents like IBV or influenza that is not in our hands to eliminate. And these situations, of course, provoke secondary E. coli infections, and we can't do anything against it. And in this case, the vaccination with a live E. coli vaccine increases resilience and livability in those birds. I'm going to show you a trial that was conducted by Dr. Cookson. I will not show all the results, but if you are interested in this, you can ask him directly. And so that was a situation where a variant infectious bronchitis virus emerged and basically exploded. And the commercial vaccines did not offer good cross protection. So they experienced, due to secondary E. coli infections, heavy erysiculitis, and on several farms, they saw mortality more than 10%. And then, of course, the question arose if a live E. coli vaccination can minimize the losses due to secondary E. coli infections. And so they started to vaccinate. First shot in the hatchery, and in some flocks this was followed by a water boost between 14 and 18 days of life. 3 different bird sizes were included in the trial, so 2, 3, and 4 kilogram end weight birds. And here again, you see the very high number of birds that were included into this trial. They looked at 2-week mortality, livability, at the percentage of farms with excessive mortality. So that means any mortality after the second week of life that exceeded more than 8%, body weights, feed conversion, life cost, and condemnations. And I'm going to show you only, due to time, only a few results. Here you see the 2-week mortality in birds that were not vaccinated in blue, and this nice decrease in birds that were once vaccinated with a live E. coli vaccine. And here you see the livability. In the non-vaccinated birds, it is less in comparison to the birds that received the vaccine once or even twice. And that basically accounts for every size of bird here. That livability is best in the birds that received 2 live E. coli vaccine shots. Also concerning the percentage of AirSec condemnations, you see the benefit of live vaccination that could be reduced in the vaccinated birds, and the adjusted feed conversion was also better in the birds here in yellow and orange that were either vaccinated once or twice. So there was a consistent trend across these 3 bird sizes. The 2-week and total livability could be improved. They saw an improved performance concerning weights, feed conversion, and costs, and the use of the live E. coli vaccine paid back. It could be nicely shown that the live E. coli vaccination reduced losses when conventional IBV programs couldn't control a newly emergent variant anymore. And I dare to say that could be also the case in other emerging primary pathogens. Well, now I would like to come to Colibacillosis in layers. In layers, the clinical picture can be sometimes different or basically not existing because the birds die very sudden. But of course, then we see post-mortem lesions. And what we also see, in contrast to fattening birds, where we saw this huge diversity of isolates, we see here in long-living birds that outbreaks are often clonal. So that means they are caused by a single strain. And also the fact that colibacillosis is not necessarily associated with IBV, NTV, APV, and so on, indicates that colibacillosis in layers is often a primary infection. And if this is the case, vaccination is actually the means of choice for prevention of colibacillosis in long-living birds. Okay, so what do we want to achieve? Of course, a reduction of mortality. By that, we increase the number of hatching and commercial eggs. We want to reduce antibiotics. So in Western Europe, we do not have any antibiotics without withdrawal time anymore. So that means during lay, we are only using colistin. And you know the situation regarding colistin, it's one of the antibiotics that is used in intensive care units in humans, and we have this discussion whether this should be used in veterinary medicine or not anymore. And of course, we can achieve also benefit for the offspring in vaccinated breeders. So these are data from Germany, and that is a big veterinary praxis that consults for Ross and Cobb broiler breeders, and they are using a killed vaccine in week 9 and 18. They started to supplement these by the live E. coli vaccine in week 24 or week 1 and 7 or in week 1, 7 and 24. And this 9.5% is the average mortality for many cycles, for many years in birds that received only the killed vaccine. And they saw a reduction for 1% when they added the live vaccine. So 1% does not seem to be much, but when you have 1 million breeders and you have in addition 1%, that means 10,000 hens that produce 120 chicks each. A chick costs roughly 34 €. That means that you gain 480,000 euro in that case. And please keep in mind that the protection of progeny is not an argument for inactivated vaccines, because these maternally derived antibodies do not protect. We looked into this and we found that broilers rather need to be immunized actively rather than depend on humoral antibodies. These are data from the Netherlands, and in this case, broiler breeders were vaccinated either in week 42, 46, and 50, or 42 and 46, or 38 and 44 of life. And they had a weekly mortality before vaccination of 1.5 to 1.4%. And after vaccination, that could be reduced to, let's say, 0.3, 0.35%, a weekly mortality. If you add this up until week 60, you will find that the overall reduction in mortality in vaccinated birds is 2.66 or 1.3 or 1.25. Well, I just said that there is no benefit in using breeders with a killed vaccine to achieve maternally derived antibodies. Because humoral antibodies do not protect. But we should keep in mind that there can be as well vertical that is the general concept, that there is vertical transmission from apex, from breeders to progeny. And in these investigations from Scandinavia, they found that one clone, a sequence type 117, was found in breeder flocks and was found also in broiler flocks. And in this case, this sequence type, this clone, caused cellulitis in these broilers. Well, I just said a killed vaccine will not help you to avoid this. But if you vaccinate breeders with a live E. coli vaccine, this will minimize replication and it will minimize shedding of these apex. And of course, then this egg transmission is very much limited, and this infection pressure on broilers is minimized. And in this case, or in all these cases, you should also consider a from top to bottom approach. Breeders have such a high value that I think the vaccine costs can be really neglected, but you will really find a reduction of replication of apex, a reduction in shedding of apex, and the infection pressure on broilers will be really minimized. Okay, these are data from commercial layers from the US. That was a company with 1.5 million birds that saw consistently E. coli peritonitis and mortality. And so they also started to vaccinate 3 times during rearing and compared the results to non-vaccinated birds until week 60. And you see here that mortality could be reduced for 60% in the vaccinated birds in comparison to the non-vaccinated birds. So from 10 to 4%. And these are results from Germany, so totally different environment. That were birds that had received an autogenous vaccine in week 18, and additionally the live vaccine in week 11 and 14. And until the 74th week of life, mortality could be reduced from 5% to 3.8%. And I think you can't get any better than this here. Yeah, in case you have any concerns that the vaccine can be applied during lay, we also checked this together with the University of Copenhagen. They vaccinated layer parent stock in Denmark at the 5th day of life in week 14 and again in week 30, and looked for shedding of the vaccine in cloacal swabs on the egg shell and also in the egg yolk and egg white. And 3 days and 7 days after the third vaccination, the live E. coli vaccine could not be found. And in addition, the bird's health and egg production were also not negatively affected. So it could be proven that the vaccine is safe when applied during lay. Maybe coming shortly back to the reduction of APAC infection pressure, I would like to share an interesting finding. We looked at E. coli isolates from litter with non-vaccinated birds and birds that had got the live E. coli vaccine. And the E. coli isolates from litter from vaccinated birds had less virulence genes than the isolates from the non-vaccinated birds. And that also applied to the E. coli isolates from lesions. So you see here a slight shift in the E. coli population towards APACs that possess less virulence genes in vaccinated birds. And looking at the long-term development, I would like to share finally these results. In the European Union, we are now obliged for more than 20 years to monitor the resistance of E. coli. And you see here the different antibiotics. And we see here the amount of resistant E. coli strains from broilers and turkeys for the different years. And I think we can see that over the years, the number of resistant E. coli strains is decreasing. Yeah, and that is due to the reduced and very restricted, more and more restricted usage of antibiotics in the European Union. So I would like to summarize and conclude. We could show that the vaccination with the live E. coli vaccine minimizes mortality, condemnation rates, and results in better performance. The vaccination with the live E. coli vaccine consistently results in a decreased use of antibiotics, and the antibiotic resistance monitoring shows a decrease in resistant commensal and avian pathogenic E. coli. So thank you very much for your attention.
Thanks so much, Rita, for such a great presentation. Really amazing. Thanks a lot. Also, we have received some questions, but I believe we can address all these questions maybe at the end of the session. Now we can have the Arabic translation with our colleague, Dr. Ahmed Adel, and then we can go directly to the question and answer session. Thanks a lot, Rita. Dr. Ahmed, the floor is yours.
Thank you, Dr. Hussein. Please, Rita, cancel your sharing. Okay, thank you. السلام عليكم. زي ما الدكتوره ريتا اتكلمت عن السيطره على عدوى الايكولاي في الدواجن. طبعا عدوى الايكولاي بتسبب خسائر كبيره جدا، زي ما حضراتكم عارفين ان هي ممكن تبقى برايمري انفكشن، يعني ممكن تبقى هي المسؤوله عن المشكله نفسها، او بتيجي سكندري او ثانويه لامراض فيروسيه زي الاي بي او نيوكاسل، او وجود اميون سبريشن زي الجمبورو يبتدي تنشط الايكولاي. زي ما حضراتكم عارفين هو الايكولاي واحده من اهم الاصابات البكتيريه اللي بتسبب respiratory disease complex مع وجود الام جي او الام اس مع العدوى الفيروسيه، بتسبب مشاكل في الكبد البريكارديتس، وبتسبب تجبنات وايرسيكولايتس التهابات في الاكياس الهوائيه، بتسبب برضو لما بيبقى في التهابات في قناه البيض بتسبب برضو سالبنجايتس، وبتعمل لي حاجه اسمها اكبرتونايتس، وبرضو بتسبب التهاب في الانسجه والجلد الغرغريني، وبتسبب برضو التهاب في السره في الصيصان. برضو من ضمن المشاكل الكبيره بتسببها اللي هي بتسبب نزول في جوده الذبيحه في المسلخ زي ما حضراتكم شايفين، اللي بتعمل حاجه اسمها سيليولايتس. طيب طبعا منظمه الصحه العالميه بتوصي دلوقتي والمنظور الجديد العالمي اللي هو الوان هيلث اللي هو الصحه الواحده، ان احنا اهم حاجه ان احنا زي ما احنا بتكير على البني ادم برضو بنخلي بالنا من الطيور او الحيوانات، بحيث ان كل حاجه بتيجي في الحيوان بتسمع في الاخر في البني ادم، فلازم نوقف الاستخدام المفرط والغير مسؤول من الانتيبيوتكس، اللي بالتبعيه بيحصل بعد كده عترات من البكتيريا اللي هي بتبقى ريزيستنس للانتيبيوتكس، اللي بتاثر بالتبعيه على صحه البني ادم. طبعا الايكولاي بايجاز برضو من ضمن الحاجات اللي هي بتخش تحت بند الامراض المشتركه اللي ممكن تتنقل من الانسان للطائر ومن الطائر للانسان، ده بايجاز شديد. فطبعا دي من المنظور العالمي اللي هو الوان هيلث اللي هو الصحه واحده. انواعها طبعا الباسوفارز بتاعتها في انواع تكافليه او اللي هي بتبقى عايشه كومنسلز، بتبقى في منها نوع من انواع الترو كومنسلز اللي هي التكافليه الحقيقيه او التكافليه الانتهازيه، ان هي يعني اول ما بيحصل اميون سبريشن تبتدي تنتعش وتسبب لي مشاكل، او انواع ممرضه بتبقى زي ما الدكتوره ريتا قالت في انواع انتستينال يعني موجوده في الانتستين فقط، وفي انواع بتخرج عن الانتستين ممكن توصل اليوروجينيتال او بتسبب مننجايتس او الافيان باثوجينيك ايكولاي اللي هي الاكسترا انتستينال. طيب انواع التقسيمات تقسيمات كتيره. الايكولاي يعني ميكروب في منه اكتر من 300 نوع، في انواع كتيره من التقسيمات، هي على حسب السيكونس الجيني او على حسب الفايلوجينيتك تري او على حسب الانماط المصليه او على حسب الفيرولنس جين اللي هي جينات الضراوه او جينات في برضه على حسب جينات الريزيستنس جين. ففي انواع كتيره جدا منه وانماط مصليه مختلفه. طبعا في لقاح اللي هو الايكولاي الحي، وهو لقاح متميز بان هو من عتره فيرولنت في الاصل، لكن عملنا فيها ديليشن للاروماتيك امينو اسيد جين، فبالتبعيه بعد ما لما بتيجي تحصن اللقاح الايكولاي الحي ده بيدخل جوه جسم الطائر، بيحصل ريبليكيشن لبعض الوقت، وزي ما الدكتوره ريتا قالت ان ده سيلف ليميتنج انفكشن، يعني بعد فتره مش هيحصل شيدنج ومش مش هيتنقل من طائر لطائر. انت اهم حاجه عندك ان هو في الفتره الاولانيه بيديك المناعات للقطيع بتاعك، وبعد كده ما بتشوفوش موجود عندك في الشيدنج او في الليترز او في اي حاجه عندك. طيب اللي يهمني في سؤال دايما اللي بيطرح نفسه، هل بيحصل كروس بروتكشن للاذر سيروتايبس؟ بالفعل زي ما وضحت الدكتور ريتا في الاستادي دي ان بيحصل كروس ريزيستنس. و بالنسبه للاستادي هنا كان البارامترز بتاعنا الارسيكولايتس سكور هنا، فطبعا كان حصل ان لما حصلنا مره واحده عند عمر يوم في الفقاسه او عند عمر يوم وبعد كده كررنا عند عمر 18 يوم، وجدنا ان حصل ان الارسيكولايتس سكور نزلت جدا بالمقارنه بالقطيع اللي هو او التجربه ان احنا ما استخدمناش فيها اللايف ايكولاي فاكسين. طيب هل ده بس خاص بالارسيكولايتس؟ لا، ده كمان بايجاز شديد خاص برضه بالمورتاليتي برسنتج. لما عملنا تشالنج بكل العترات مع بعضها حتى وجدنا ان احنا برضه المورتاليتي نزلت جدا بالمقارنه بالنون فاكسينيتد فلوكس. تمام. طيب الايكولاي زي ما حضراتكم عارفين هي مشكله كبيره جدا في اللحم، مش بس في اللحم، هنيجي برضو في الامهات وفي البياض. زي ما حضراتكم عارفين ان هو في الاميون كومبرمايزد او لما بيحصل تثبيط مناعي زي ما اتكلمنا من شويه بيتنتعش الايكولاي لما بتكون عندك ظروف الفرشه مش كويسه، لما بيكون عندك امونيا في العنابر، كل دي ستريس فاكتورز بتاثر على قطعان اللحم بالنسبه لك. لما بيجي بيبقى برضه سكندري للاي بي او انتعاش لاذرز بكتيريال انفكشن، برضه بتنتعش الايكولاي. طيب دي استادي عن في البرويلر، الهدف منها نشوف المورتاليتيز. طبعا هنا كان البارامترز ان في قطيع استخدم جنتامايسين ان اوفو، وفي قطيع تاني استخدم لايف ايكولاي فاكسين. زي ما حضراتكم شايفين، زي ما الدكتوره ريتا قالت، الريميننج مورتاليتي اللي هي المورتاليتي النهائيه، وجدنا ان في نزول في نسبه المورتاليتي بالمقارنه بالكنترول اللي هو استخدم بس الجنتامايسين. الاوفر اول مورتاليتي واز لور ان فاكسينيتد فلوكس. طيب مش كده وبس، ان احنا مش ننزل المورتاليتي، كمان بتنزل كمان استخدام الانتيبيوتكس. زي ما حضراتكم شايفين النيدز بتاعت الانتيبيوتكس في حاله اللايف ايكولاي فاكسين نزلت بالمقارنه بالنون فاكسينيتد. وكمان الديوريشن اوف تريتمنت، وجدنا في اللايف ايكولاي فاكسينز قللت التريتمنت ل 2.6 دايز بالمقارنه ب 6.8 يوم في النون فاكسينيتد اللي هو استخدم فيها الايه الانتيبيوتكس. مش كده وبس، في المورتاليتي او ريدكشن اوف انتيبيوتكس، بل بالعكس كمان حصل برضو ان في ليس كوندمنيشن، يعني نسبه الاعدامات او الاستبعادات كانت قلت بكتير بالمقارنه بالجروبات اللي ما خدتش اللقاح. وبرضو كان في معدلات تحويل كانت افضل عن الجروبات اللي ما خدتش التحصين. برضو دي ترايل تانية بتوضح فيها ان احنا برضو بالمقارنه بالجروب حصل فيه استخدام الانروفلوكساسين بالمقارنه بالجروب استخدم اللايف ايكولاي فاكسين. زي ما حضراتكم شايفين برضو نزلت المورتاليتي اوفر ذا تايم. زي ما انتم شايفين الفتره الاولانيه ممكن حد يقول طب البولفاك ايكولاي حصل هنا يعني الدنيا عاليه شويه. طيب ده بسبب ان لسه الايكولاي فاكسين ما اشتغلش، لسه بياخد فتره اللي يحصل ريبليكيشن، ثم بعد ذلك الاميونيتي بتاعته بتبتدي تشتغل وبيحصل بعد كده ديكريز للمورتاليتي. برضو زي ما اتكلمت الدكتور ريتا ان برضو السسبتبل بيردز او اللي هي عندها تندنسي للقابليه ان يحصل فيها مشاكل ايكولاي، اللي هي مثلا في البيرنت ستوك او الامهات اللي هي عمرها كبير وبينزل بعد كده مشاكل ايكولاي للصيصان بتاعتها. طيب هنا في مجموعات استخدمت اللقاح، وفي مجموعات لم تستخدم اللقاح. ده كان عباره عن 15 قطيع، هنا كان 6 قطعان. زي ما حضراتكم شايفين الفرق ان حصل برضو هنا نزول للمورتاليتي او النافق بالنسبه للقطعان اللي ما حصلش فيها تحصين. وبرضو بإيجاز شديد برضو هنا في القطعان اللي حصل فيها تحصين كانت نسبه الكوندمينيشن او الاستبعادات او الاعدامات في المسالخ كانت اقل منها اللي لم يستخدم اللقاح. وبرضو كان برضو حصل فينا في نفس الترايل ريديوس في اليوز اوف انتيبيوتكس، يعني نزلت استخدام انتيبيوتكس. تمام. نفس الكلام برضو هنا حصل برضو بالمقارنه بالجروب اللي هو انفاكسينيتد اللي هو ما اتحصنش واللي اتحصن باللايف ايكولاي فاكسين زي ما حضراتكم شايفين، وحصل ريدكشن للسيلولايتس ونسبه الاستبعادات بالمقارنه بالكنترول، يعني حصل ريدكشن حوالي 80%. تمام. زي ما الدكتوره ريتا اتكلمت برضو، قالت ان انت في كوست من الفاكسين بس في ريتيرن اوف انفستمنت. الريتيرن اوف انفستمنت بتاعنا اللي هو معناها ان انت استثمرت في اللقاح، ولكن انت خدت بروفيت او هامش ربح اعلى. طبعا انك انت قللت الاعدامات، قللت الوفيات او النافق، قللت استخدام الانتيبيوتكس، وبرضو معاملات التحويل كانت اتحسنت كتير. تمام. طبعا الترايل اللي هي اتكلمت عنها الدكتور حسين كان عملها قبل كده والدكتوره ريتا برضو عملتها، اللي هي استخدام اللينكوسبكتين تريتمنت، واللينكوسبكتين تريتمنت مع اللايف فاكسينيشن من الايكولاي. زي ما حضراتكم شايفين اللي حصل تحضين هنا في الاول على اللينكوسبكتين من 3 ايام وهنا حصل اللينكوسبكتين اتحضن 3 ايام، ثم بعد ذلك استخدمنا اللي هو لقاح الايكولاي الحي، وكنا شفنا التوتال مورتاليتي زي ما انتم حضراتكم شايفين في حاله استخدام الانتيبيوتكس مع وجود اللايف ايكولاي فاكسين كان في فرق كبير جدا في المورتاليتيز. اتحسن النافق كتير جدا بالنسبه اللي حصل فيه بس استخدم اللينكوسبكتين من يوم يعني اتحضن 3 ايام. وبرضه كانت برضه معدلات الاستبعادات افضل كتير جدا في حاله استخدام الانتيبيوتكس مع اللايف ايكولاي فاكسين. وبرده كانت معدلات الاوزان اتحسنت كتير بالنسبه لاستخدام اللينكوسبكتين لوحده عن استخدام اللينكوسبكتين واللايف ايكولاي فاكسينز. وبرده اشارت ان هي في الاستادي دي كانوا برده بصوا للريدكشن بتاع الانتيبيوتكس، برده كان ان احنا ما استخدمناش تاني انتيبيوتكس في الدوره دي، ودي كانت حاجه كويسه جدا. طيب في هنا برضو ترايل كانت في امريكا قالت ان هي فيها ان كان في مزارع فيها فاريانت اي بي، وكانت اللقاحات اللي موجوده للاي بي ما كانتش بتصد كويس، وكان دايما بيحصل سكندري انفكشن او عدوى ثانويه من ايكولاي، فكان بيحصل اصابه شديده جدا من التهاب الكاس الهوائيه الهيفي ايرسيكولايتس. فهي دلوقتي بتقول لو احنا حصلنا لايف ايكولاي فاكسينيشن، هل ده بالتبعيه يعني بطريقه اندايركت او غير مباشره هيقلل لي المشاكل اللي بتقابلني، بدل ما ان احنا بس الايكولاي مع وجود الفاريانت بيسبب لي مشاكل اللي هي الهيفي ايرسيكولايتس. طيب زي ما حضراتكم شايفين ان هنا وجدت عند استخدام اللايف ايكولاي فاكسين، تمام، والجروبات اللي ما حصلش فيها ان ما استخدمتش اللايف ايكولاي فاكسين، لا حصل هنا في تطور، وفي كان نسبه النافع اقل في حاله استخدام اللايف ايكولاي فاكسينز. وكمان برضو في حاله الليفابيليتي كانت في تحسن ملموس جدا، سواء استخدمنا لايف ايكولاي فاكسين مره واحده او استخدمناه مرتين، تمام، بالمقارنه بالجروبز اللي ما اتحصنتش باللايف ايكولاي فاكسين. تمام. كان برضو حصل تحسن في نسبه الاستبعادات بسبب الايرساكيولايتس، تمام، باستخدام 1 دوز من اللايف ايكولاي فاكسين او 2 دوزز من اللايف ايكولاي فاكسينز. وبرضو كان حصل برضو نسبه التحسن في الفيد كونفرجن كان واضح جدا في حاله اللي هو استخدام اللايف ايكولاي فاكسينز بالمقارنه ب 2 لايف ايكولاي فاكسينز. سمري هنا ان وجود الايكولاي فاكسينز حتى لو الاي بي فاكسينيشن مش قادر يصد ضد الفاريانت، فالتبعيه انت قللت موضوع السكندري انفكشن او العدوى الثانويه، فقللت لك اللوسز اللي هي اللي بتحصل عندك. طيب بالنسبه للبياض والامهات، طبعا الايكولاي مشكله كبيره جدا بتسبب مورتاليتيز. طبعا احنا الهدف من التحصين ان احنا نقلل النافق، بنزود بيض التفريخ الكويس اللي ما حصلش فيه اي برضه نقل للايكولاي سواء على الشل بتاعته او دخلت جوه البيضه نفسها. طبعا برضه مهم جدا ان انت لو ده قطيع لايرز برضه بياض، فانت لازم يعني برضه لو في اصابات ايكولاي استخدامك للانتيبيوتيك ممكن يحصل ريزيديوز او متبقيات الانتيبيوتكس جوه البيضه. فطبعا اللايف ايكولاي فاكسينيشن ده طبعا حاجه مهمه جدا ان احنا نبعد عن الانتيبيوتكس نفسها. تمام. طيب دكتوره ريتا كانت اتكلمت عن فائده اللايف ايكولاي فاكسينيشن كبرايمنج في وجود ان احنا عندنا كيلد فاكسين لوحده غير كافي انك يديك المناعات الكويسه، تمام. فلازم يبقى في برايمنج عندنا من اللايف فاكسينز اللي هو اللايف ايكولاي فاكسينز اللي عندنا، سواء اديته زي ما حضراتكم شايفين مرتين كيلد، مره لايف، مرتين كيلد، مرتين لايف، مرتين كيلد، 3 مرات لايف، هتجد الاوفر اول او معنى الافريج او المتوسط المورتاليتيز كان اقل من استخدامك بس ل2 كيلد فاكسينز. تمام. برضه هنا بايجاز شديد زي ما دكتوره ريتا قالت، في حاله الامهات التسمين كان برضه استخدام اللايف ايكولاي فاكسينيشن اثناء الانتاج كان فيري سيف، وكمان عمل لي الريدكشن في التوتال مورتاليتي بالمقارنه بعدم استخدام الفاكسينيشن. طيب يهمني جدا برضو استخدام اللايف ايكولاي فاكسينيشن ان احنا نقلل الفيرتيكال ترانسميشن، سواء حتى على الشيل من بره او دخلت حصل سلبنجايتس او التهاب في قناه البيض، ادت في الاخر ترانس اوفريان ايكولاي او نزل مع البيضه ايكولاي. فطبعا زي ما قالت ان احنا بسبب اللايف ايكولاي فاكسينيشن ده انت بتقفل السلسله كلها الغذائيه او سلسله الانتاج كله عندك من الامهات الى حتى ان ما يحصلش عندك اعدامات جوه المسلخ في حاله اللحم نفسها. برضو حتى في قطعان البياض استخدامك لللايف ايكولاي فاكسينيشن عمل ريدكشن برضو للمورتاليتي زي ما حضرتك شايفين من 10% الى 4%. بايجاز برضو شديد. احنا طبعا في ناس يقول لك عندي كونسيرن، طب انا خايف ان الايكولاي فاكسينيشن حصل شيدنج ليه وعمل شيل كونتامينيشن، عمل كونتامينيشن لليوك والايج يوك والايج وايت البياض والصفار، او عمل شيدنج في الانفايرمنت نفسه في المزرعه. طب احنا حصلنا عند عمر 5 ايام لايف فاكسينيشن، عند عمر 14 يوم، وحتى كمان اثناء الانتاج عند عمر 30 يوم 30 اسبوع. وكانت عملنا اختبارات بكتيريولوجيه ووجدنا ان لايف ايكولاي فاكسين كانت ما فيهاش اي شيدنج او موجوده على الشيل من بره او في الصفار او البياض او حتى بالكلواكه السوابس، مساحات من الكلواكه ما كانش فيه اي نوع من انواع الشيدنج. وكمان كان صحه الطائر كانت كويسه، وكان الانتاج البيض نفسه ما تاثرش بالقصه دي. طيب زي ما الدكتوره ريتا قالت، استخدامك او بعدك عن استخدام الانتيبيوتكس لفترات طويله فتره بعد فتره بتخلي ان البكتيريا دي او الانتيبيوتكس يعني ايه ريجين، او معناها تاخد تاني اللي ما يحصلهاش ريزيستنس. يعني معناها يعني بعد فتره الايزوليتس اللي كان عندها ريزيستنس للانتيبيوتكس، لا الانتيبيوتكس بتقدر تاخد تاني مقاومتها ضد، او بتستعيد الافيكاسي بتاعتها او قابليتها ان هي تموت البكتيريا دي تاني. فلازم استخدام البلفاك ايكولاي دوره بعد تانيه بتخلي الريزيستنس تقل. تمام. نفس الكلام اتكلمت برضو عن الانفكشن بريشر، او اللي هو الحمل البكتيري من الافيان باثوجينيك ايكولاي اللي هو الايكولاي الممرضه. طبعا مع استخدام اللايف ايكولاي فاكسينيشن قلل لك نسبه او افريج نمبر اوف جينز اللي هم بتاعت الجينات بتاعت الفيرولنس بالمقارنه بالنون فاكسينيتد فلوك او اللي هو ما اتحصنش، سواء حتى المعزولات اللي خدتها من الفرشه او المعزولات اللي انت خدتها من الطائر نفسه من الليجنز نفسها. طيب الكونكلوجن او الملخص زي ما الدكتوره ريتا قالت ان اللايف ايكولاي فاكسين بيقلل لك المورتاليتي، بيقلل لك نسبه الاستبعادات في المسلخ، بيبقى فيه عندك اداء قوي جدا للقطيع بتاعك. طبعا بيقلل لك استخدام الانتيبيوتكس سواء كما ونوعا ووقت كمان. طبعا الانتيبيوتيك ريزيستنس طبعا مع الوقت بتقل بسبب استخدامك للايكولاي، فده طبعا شيء كويس جدا. شكرا جزيلا لكم. السلام عليكم.
شكرا دكتور احمد على العرض الاكثر من رائع وسامري فعلا تو ذا بوينت. وطبعا واضح من كلام الزملاء ان السيطره على الكوليباسيلوزيس كمرض من الامراض المهمه جدا جدا في المشاكل التنفسيه المعقده، كواحد من الكومبليكيتنج ايجنت لمعظم الامراض الفيروسيه زي الاي بي وزي الانفلونزا الاتش 9 اللي هي اللو باثوجينيك افيان انفلونزا والنيوكاسل. السيطره عليه بقت مهمه جدا جدا عشان تقلل من حده الاصابات الفيروسيه وحده الوفيات اللي ممكن تكون حاصله معاها. فالسيطره عليها احنا عندنا حلول كتير جدا، ممكن نبدا نستخدم مضادات حيويه كتير جدا جدا، وده بينشا عنه كثير من المقاومه البكتيريه للمضادات الحيويه، وده بقى واحد من اخطر المهددات لحياه البني ادمين، يمكن اكتر من الحروب كمان. وده كان مش كلامي انا، ده كلام منظمه الصحه العالميه. وبالتالي على قد ما نقدر طبعا نستخدم اللقاحات الحيه للايكولاي عشان تبدا تخفف من حده الاصابه بالايكولاي، ده شيء مهم جدا. بس هنا السؤال اللي هيتبقى، هل احنا هنمنع استخدام المضادات الحيويه تماما؟ طبعا الاجابه لا، مش هنقدر نستغنى عنها، ولكن طبعا احنا في زواتس وده الاين طبعا مع المعايير والانستراكشنز والجايدنس بتاع منظمه الصحه العالميه، وده اللي بتطبقه وزاره الزراعه السعوديه، هو ان احنا ازاي نقلل استخدام المضادات الحيويه، ازاي الاستخدام الامثل للمضادات الحيويه، ازاي ان احنا نقلل المقاومه البكتيريه المتعدده للمضادات الحيويه اللي بيسموها المالتي دراج ريزيستنت سترينز من البكتيريا. فاعتقد الحمد لله احنا كلنا الايند وكلنا بندعم هذا الاتجاه، ان احنا بندعم الاستخدام الامثل للمضادات الحيويه للحفاظ على كفاءتها. وده كان باين طبعا من البرزنتيشنز بتاعت الزملاء سواء كالين او ريتا او دكتور احمد، فطبعا ده كان واضح وجلي. دلوقتي اعتقد احنا عندنا مجموعه من الاسئله. So please يعني allow me to speak in English just to introduce the different question that we have received in the question and the answer chat box to our speakers today. So I believe one of the common questions that I have received from different attendees is the relation between the infectious bronchitis and the APIC or avian pathogenic E. coli. So this question can be to Rita or even to Kalen, because both of them maybe worked a lot in this, the relation between E. coli and infectious bronchitis, knowing that in Middle East we have a heavy challenge of infectious bronchitis. So Rita?
Yeah. So relation E. coli and infectious bronchitis. Yeah, that is a good topic. So what is our strategy about it? We recommend to really monitor your flock, not on national level, let's say, but really monitor different geographical areas, even monitor single farms. You have to know what is going on your specific farm. You have to know your individual field pressure, and you have to adapt your vaccination program accordingly. Let me give you an example for Germany, for instance. So the general concept is that you give for priming a Massachusetts vaccine. And well, we have in Germany a vaccine registered that contains a Massachusetts H120 strains, but in addition, a variant strain D274. And if you administer two strains, immunity is already broader. As a second vaccination for broilers, because also we have a very high field pressure, IBV field pressure, we recommend to monitor. And in many, if not most cases, we can prove that we have a very strong QX pressure in Germany. So it is very, very clear the second vaccination should be a QX vaccination. And we have found that the combination from H120, D274 and QX not only gives protection against QX and Massachusetts, but also a very good protection against other variants such as 793B, Italy 02, variant 2. Yeah, and if you have tackled this, you will see and find that the E. coli problems are already minimized. But if you want really to support your birds, you still might have a bad chick quality. You might still have impaired bad keeping conditions in our winter months, for example. You want to somehow support the birds, and then E. coli vaccination is really beneficial, because there is always some amount due to E. coli infection, some mortality due to E. coli infection, but you can minimize this by increasing livability due to E. coli vaccination. Does this answer your question?
Yes, Rita, very, very clear. But maybe also we want to emphasize about the pathogenicity of the IBV. You have presented a publication or a study for Kalen Coxon showing that controlling the Colibacillosis will already resulted in reduction of the severity and the mortality associated with the Marva strain. So if you are okay, we can give the floor to
Yes.
to Kalen Coxon, because he is the owner of this work and this trial.
Sure.
to give more about it.
Yeah, sure. That is Kalen really knows the details. Yes.
Yeah. Thanks.
Well, you know, bronchitis can kill broilers, right? We know this, but it can do it in two ways. It can do it directly if you have a nephropathogenic strain, and that can directly cause mortality, or it can do it indirectly, and that's usually our respiratory strains of infectious bronchitis virus, and that makes up actually the lion's share of them. And you know, as we know, you have the primary infection from bronchitis, and then the E. coli is what the birds succumb to if they die from a respiratory disease. So then it goes back to how do you control the bronchitis, as Rita was saying. If you have very good control of your infectious bronchitis, then you will have very little involvement of secondary E. coli disease secondary to bronchitis, because you don't have that primary infection. But if you do not have very good control of your infectious bronchitis challenge, then you have greater potential for secondary E. coli behind the E. coli from behind the bronchitis challenge. So that's the big question. What circulating bronchitis viruses do you have in a given region, and how well do my various program options cover against those viruses? If they cover well against them, then low potential of secondary E. coli from infectious bronchitis. If they don't control them well, then E. coli vaccination can be a viable option to reducing secondary losses. Then, of course, finally, keep in mind that you know, you can have E. coli opportunities regardless of infectious bronchitis situation. So you can have either E. coli being a primary disease opportunist, and that goes back to how pathogenic are your E. coli strains, how many virulence genes they're carrying, what are the other management factors that can contribute to a higher load of E. coli in the environment. And then, of course, we talked today about ways that if birds are immune compromised, that will increase their risk of E. coli disease.
Okay, very clear. Thanks a lot, Rita. Thanks a lot, Kalen. Also, if we are talking also about the immune suppression, there is here two questions regarding the role of the hot IBD vaccines in respiratory disease, especially with IB variant 02.
That's always a question. The usage of strong vaccines, they do have a potential to cause some level of immune suppression in their own right, hopefully not on the same level as a wild type. So that becomes a balancing of what is your relative risk of early IBDV infection and the immune suppression that can cause, of course, the other sequelae of IBDV, versus what are the relative risks of using a strong vaccine and applying it at, say, 12 to 14 days of age. There's of course some potential that there can be a minor compromise in immune response, and so it has to be weighed against the the risk of the wild type creating even more of an impact on the immune system of your birds. Of course, we do have other options, as I mentioned today briefly. If we need to have a strong onset of immunity, active immune response for IBDV in our broilers, and that would be either your immune complex vaccines or your recombinant vaccines used in the hatchery. And those are good viable alternatives to placing strong vaccination at 2 weeks of age, for example. If you have an overwhelming IBDV challenge, especially VV-IBDV, there's no better way to control that than with a strong vaccination, a strong vaccine applied in the field around 2 weeks plus or minus. However, if you're able to control your IBDV challenge from the hatchery with either immune complex vaccine or a recombinant vaccine, then there may be there's less potential for them to have a residual effect on the immune system in their own right. The immune complex vaccine, it's a strong vaccine, but it's combined with antibodies that make it behave differently than a truly strong, what I would call naked vaccine. And it's very has a lot of benefits. And then of course recombinants have no impact on the bursa and on bursal depletion by themselves.
I believe this also will take us to the next question, Kalen, because I have question here. If you have early challenge with very virulent IBD, which one of the two options that you have explained is superior, the immune complex or the vector vaccine?
If you have a variant bronchitis?
Not variant, very virulent IBD.
Oh, very virulent. Okay,
yes.
Very virulent. Well, that's a really good question. You know, my feeling is what I've heard and heard through other people's experiences is that recombinant vaccines, if used indefinitely, the field challenge can sometimes adjust to that. And there's a number of possible reasons why that can occur, but it has been documented in various areas where VV-IBDV is present. I would say that a live vaccine, it works differently. There's a blocking mechanism with live vaccines, competition for binding sites to the B cells that you don't have with a recombinant vaccine. And I think that is a distinct advantage, so that your immune complex vaccines have a little bit of an advantage, I believe, against a VV-IBDV situation. That's not to say that a recombinant program can't be very effective in a high VV-IBDV situation, but it might be something where if you really do like the aspects of recombinant vaccine, put it into your program strategically, say on an annual basis. So you maybe one part of the year you use a recombinant, and another part of the year you switch to an immune complex strategy. The nice thing about that is you can change one to the other because they're both being used in the hatchery. So that could be a relatively seamless endeavor.
Okay, very, very clear. So there was a question here for Rita. Can E. coli live vaccine grow in media of bacteria? And if no, then how we can know if they're shedding or not?
So it can grow in any media that contain aromatic amino acids, and basically any, let's say, normal, so to say, agar medium like blood agar contains this, and so the vaccine can be grown on these media. But you have the difficulty that also the E. coli that are anyhow in your gut are also shed, and so you have to differentiate between these two. And if you have a suspect, let's say, you have to grow this in parallel on, let's say, blood agar and on the so-called minimum agar that does not contain these aromatic amino acids. And if a strain grows on both media, it's a field strain, and if it only grows on the blood agar but not on the minimum agar, it's a vaccine strain.
Okay, so we can differentiate between the vaccinal strain and field strain based on the gross on the minimal or the basal agar media.
Yes,
right.
That is, yeah. Of course, we can differentiate based on this, but also if we have single isolates, we can also look for the presence of the ARO8 gene, whether it is present or not. We can sequence, so we have many means to identify the vaccine.
Okay, but the question here regarding the shedding, because in the presentation that you have in one of the slides that you have presented, Rita, that even the live vaccines can be used during laying, right?
Yes.
Okay, and okay, based I believe on USA guidelines, also it's safe to be used by the label.
No, by the European. That is, we have two labels.
Yes.
We have the US label and European label.
Yes, I'm talking about USA label, yes.
Yes, and according to the US label, you can use the vaccine whenever you want. But because we had no data for the European registration for use during lay, in that case, authorities will say that you cannot use it during lay. And so that is why we are generating data right now that prove what we already know from the US data use, that the vaccine is totally safe, but we are generating data in order to prove that for the European authorities.
Okay, very clear. There is another question here for you, Rita, also, if we are vaccinating against Colibacillosis using live vaccine at day 8 and the flock is mycoplasma positive, the vaccine can give good results. I believe this is aligned with the other questions relating the E. coli with IB, relating E. coli with mycoplasma. Here the question is related to mycoplasma.
Okay, so a good result is relative, right? I would dare to say mycoplasma will still do its job, but you have a good chance to minimize your losses due to secondary E. coli infections if you just increase immunity against E. coli infections. So we have that experience from South Africa, where they also have a very high mycoplasma field challenge. And in that case, they are able to somehow control E. coli infections during lay in layers by vaccinating E. coli every 12 weeks. So they can control to a certain extent also the losses due to mycoplasma and secondary E. coli infections.
There is also one question here. I received this question while you are presenting the data from Germany using antibiotic lincospectin in first 3 days followed by E. coli vaccine. The question here, what about birds density per square meter in this trial? if I understood the question well.
Yeah, so the stocking density in Germany is 30, if you have normal commercial birds, what they were in this case, 39 kilogram per square meter.
How many kilogram, Rita? Sorry.
39.
39. Yeah, this
yes.
is included. Yes. Okay. Okay. Thanks a lot. Also, there is one question here that already Kalen answered in the chat box regarding Reo vaccination. Kalen, do you prefer Reo killed vaccine in the first 7 days old in breeder?
Yeah, and I did see there was another question about live versus killed.
Yes.
I'm a very big proponent of using both, of using live vaccination and killed vaccination. For Reovirus, if you have an opportunity to give a live vaccine, especially if you can inject it at around 7 days of age, one of these tissue culture adapted Reovirus vaccines, those can be a very effective way to make sure that that pullet is protected from Reovirus infection in those first few weeks, so that pullet herself won't succumb to leg problems, for one, and number two, if they do become exposed to a wild type infection, especially a variant, that they're less likely to remain persistently infected, where they can start to vertically shed that virus to progeny. So I'm a big proponent of live vaccination early, and then switching over to kill vaccination. What I don't know is what live vaccines you have available in your markets. But for example, in the US, not only do we have the attenuated vaccines that can be injected either at day of age or in the first few days, but we also have less attenuated live Reo vaccines that can be applied at, say, 6 to 8 weeks of age, which is a good way to make sure they're still protected until they get their first kill vaccine. Now, I've seen some areas that don't have that option, that you'll see that some people will give their first killed Reo vaccine as early as 6 to 8 weeks of age. And I think that's also a reasonable strategy. One last comment. I do not regard the live vaccines as potential for being shed to broiler progeny. I just don't think that that happens in reality. The only threat of Reo passing from breeder to progeny is if it's a wild type.
Okay, very clear, Kalen. One more question regarding adenoviral infection, because it's quite endemic in the region. So if, let's say, we have vertically transmitted or even horizontally transmitted adenoviral or adenovirus, especially serotype 4, if this can affect the immune response to the vaccines, if we are using, let's say, good vaccines against IBV.
Absolutely. Any of these viruses, if they're infecting the birds, let's say it's a broiler, inside, especially inside that 2-week period, they will have the potential of depressing the immune response of the bird, and therefore any vaccines that you're applying to that broiler are the immune response will be compromised.
Okay, very clear. Also, I have one question here to Rita regarding the live E. coli vaccination. What are the precautions while using E. coli vaccine, live E. coli vaccine, especially while using antibiotics and organic acids?
Okay, so you should be cautious concerning water quality when you solve the vaccine. So keep in mind the general parameters like ions, metals, and pH. There shouldn't be any disinfectants in the water line, and there shouldn't be any antibiotic residues in the water line, and do not underestimate biofilms, for instance. So you should consider rather to spray vaccinate than to apply the vaccine via the drinking water line. Concerning withdrawal time, we claim in our European SPC that you shouldn't use any antibiotics that are efficacious against gram-negatives 7 days before and 7 days after vaccination. Anything else?
Okay, Rita, I have seen also some publications, also maybe Kalen, correct me if I'm mistaken, because I have seen some publication in USA regarding, let's say, using gentamicin in ovo or safety for in ovo, and then at day 1, the E. coli vaccine has been applied.
Okay, yeah, okay, Kalen knows, yeah.
Yes.
Yeah, we looked at that, and we found that there was some reduction in the response to E. coli, but it wasn't a significant reduction. So we still were able to demonstrate significant protection of the E. coli vaccine given at day of age when the gentamicin was being applied. And we have also seen that supported by some of our early broiler trials in the US, where gentamicin was a common additive in the hatchery at the time. XNL, we saw more of an inhibition of the E. coli vaccine response when that was included in the hatchery. So it does depend on the antibiotic, but you know, and I don't know if how much antibiotic usage is still being done in hatcheries. Is that still pretty common?
Do you mean in ovo, Kalen, or in the first 3 days?
Either. No, either in ovo or sub-Q.
I believe it's the XNL can be used in ovo or in the first or in hatchery subcuts. This is a common practice, and also as Rita also presented, there is a common practice to use some antibiotics in the first 3 days, as per the trial of Rita.
But Hussein, that is prophylactic use of antibiotics is not allowed anymore. And so lincospectin is used, but that is a metaphylactic approach. So when the birds arrive at farm, they are already infected with E. coli or enterococci. So this metaphylactic approach use is somehow justified, but a prophylactic approach in future will not be possible anymore, I think.
Yes, Rita, this is also the same. This is here, I believe, metaphylactic approach as well. Okay. The next question here regarding inclusion body hepatitis. How can I know my chicks are free from inclusion body hepatitis at day 1?
Yeah, that's a good question. I don't think you can get that answer by testing day of age chicks. So you have to kind of put that together based on whether you have broiler flocks presenting with clinical signs and diagnose that they have adeno infections, and when are they seeing that? If it's presenting, you know, by 2 weeks of age, then it's a strong evidence that you probably do have some vertical transmission that's happening. If it's not presenting until after that time point, then it would be compatible with just having horizontal exposure, or from the virus being present on that farm. And then, of course, you go back to your breeder program, and if you, assuming you have a IBH vaccination program, you want to be evaluating and ensuring that your pullets are seroconverting to your vaccination program before they are going to the layer house. And I would probably want to continue that serology in the layer house in a couple strategic areas, just to confirm that you're not getting a rise in seroconversion during the lay period, like that example I showed with Reovirus. It would be a very similar situation. If you have rising seroconversion to adenovirus in lay, there's a pretty good chance that your hens are also shedding vertically, which is going to have the greatest impact.
Okay, yani I have many questions that I would like to answer, but I see the time is running very fast, and I believe also Dr. Raed would like to make the closing. So this is the last questions, and I believe we can address all the questions that will not be answered and will be sent to the sender of the question. The last question regarding what is your advice, which level of Reo and the chicken anemia virus ELISA titer in breeders in order to protect the broilers?
Yeah, I don't know if there's a general mean titer that people should set as a goal. I think the most important thing is to look at how many birds are actually seroconverting to CAV before they're moved to the layer house. The most important thing is to reduce the potential of vertical transmission, because with vertical transmission, you're going to have birds, broilers that are infected very early and have the most impact on the immune system. So that's the #1 priority that I would be targeting with my vaccination program and evaluating serology to that program, is to not be missing birds, make sure they're all seroconverting prior to housing. And then after that, then you're looking at how great is my wild type exposure on my farms. And that comes down to cleaning and disinfecting to reduce that risk. But if you have a high risk, if you have a really high challenge, then I might say 6,000 is the mean titer that I set for a goal that I want my breeders to have, through production, but maybe it's 4,000, depending on your level of field challenge in a given area. It's kind of like the IBD charts that I showed you. If you have a low IBD field challenge, then your breeder program has to be so high. If you have a really high IBD challenge environment, then your breeder program has to be higher. So it again goes back to the level of challenge and risk.
Okay, very good. I believe now most of the questions have been already answered, and as I explained, the question that we couldn't address, it will be addressed after this meeting, and it will be sent by email to the sender. Myself and Dr. Ahmed Adel will work on this. Again, thanks a lot for our speakers today. Thanks a lot for our participants and attendees today, and really appreciating your active participation and interaction. Thanks so much. And also I would like to thank again the Ministry of Environment, Water and Agriculture to give us such a great opportunity to be with you today. And now I would like to give the floor to Dr. Raed to have the closing for this great workshop. دكتور رائد, the floor is yours.
شكرا دكتور حسين جلال، الله يعطيك العافية. دكتور أحمد عادل، جهد تشكرون عليه من شركة زويتس، والشكر موصول لزملائنا في الإرشاد البيطري، الإدارة العامة لخدمات الثروة الحيوانية على تنظيم هذا الحدث. كذلك لا أنسى أن أشكر زميلي وعزيزي الدكتور سامي قاسم، على أمل أن نلتقيكم إن شاء الله في ورش عمل قادمة. كذلك أحب أقدم الشكر للمحاضرين. I'd like to thank Dr. Coxon and Dr. Weber. It's very great pleasure having you with us today. It was really fruitful presentations, even though that I'm not working in the poultry sector, in the veterinary domain, but still it's a refreshment for my knowledge and information. Thank you very much, and looking forward to see you in, as soon as possible in any workshop. Thank you.
Thanks a lot. شكرا دكتور رائد، شكرا جدا لحضراتكم. شكرا. السلام عليكم.